Okay, Chair, you're now live.
Thank you. Good morning. I'd like to welcome all councillors, officers and members of the public viewing on YouTube to this meeting of the Children's, Adults, Health and Wellbeing Policy Developments and Scrutiny Panel. My name is Councillor Vic Pritchard and I am the chairman of the panel. I will now call on the names of the other members of the panel to ask them to confirm they are present. Councillors Michelle O'Doherty.
Present.
Councillor Kumar.
Present.
Councillor Ruth Malloy.
Present. Morning.
Andy Waite.
Present.
Paul May.
Present.
Liz Hardman.
Present.
And Alison Bourne.
Present.
The panel also has 3 co-opted members, and they are David Williams. I'm not sure he's present, is he? No, Chris Batten.
Present.
Thank you very much. Also present are the report authors and the items on today's agenda, and they will be introduced as they make their way through the agenda. Can I remind members and officers to keep background noise to a minimum, to only speak one person at a time and not to speak over others. Please mute your microphones when not speaking and then unmute when I invite you to speak. Please indicate if you wish to speak by using the chat facility on Zoom by typing MIS, may I speak, and I will call you to speak in turn. Should the panel need to take a vote in order to expedite the results, I will assume a majority position. So if you wish to abstain or vote against, please indicate this in the chat when moving to the vote. Does anybody have any questions? No, then I'll move on to item 2, apologies for absence and substitutions. Are there any, Mark?
Hi, Chair. Yes, Chair. We've had apologies from councillors Jess David and Mark Roper, and also from one of our co-optees, David Williams. Councillor Kumar is here as a substitute for Councillor David.
Fine, thank you very much. Moving on to item 3, declarations of interest. Are there any declarations of interest? No, then item 4, to announce any urgent business. Sorry,
I put MIS. Can I just declare an interest because I'm a non-executive director on the board of Sirona, and there are some issues around integrated care which I don't think it will be a declarable pecuniary interest, but I want to register my interest, please.
okay, fine, thank you.
Thank you.
So moving on then to item 4, to announce any urgent business agreed by the chairman. There is no urgent business. Item 5, and that's items from the public or councillors to receive deputation statements, petitions or questions relating to the business of this meeting. Again, there aren't any. And so then we move on to item 6. And I'm going to take item 6 and item 7 together because they are 2 separate lots of minutes. One from the 23rd of October and the other from the 3rd of November. I beg your pardon, that is all of item 6. So they run from pages 7 to 36. Matters arising from that. Are there any matters arising, please? Kevin.
Yeah, thank you, Vic. Just a quick, if Leslie is around, just to ask her very carefully on page 40, I've got, sorry, pack page 7. I do apologise, so the numbering is not quite right on my page. There was Sean Walker McAllister asking about the escalation protocol I was asking her about. And Leslie, I just wondered, because I didn't see anything coming in your report, just whether that's still undergoing or whether we've got to come back to it at another point.
So thank you.
Thank you, Councillor. So my understanding is that Sean Walker has had a couple of meetings in relation to the escalation protocol now for the BCSSP. It's not finalised as yet, so we will need to send that through to you when it is finalised, but the work has been taking place.
Fabulous. And Vic, may I keep going with a
Yes,
couple of points?
certainly.
Thank you. And on the next page, page 8 to, I don't know whether, Kevin, you've heard anything at all back from our good friend, the Secretary of State, because the last time you were still trying. So I don't think it's on page 7. It was just a thread from last time, but your name was mentioned on page 7.
Oh, unfortunately not, Kevin. No.
Okay, bless you. And Vic, there was the bit on the following page, page 9, about the music service. And I don't know whether Chris Wilford is with us, but whether the AP Benson report, the second report, has come out, or whether it's still under review at the moment.
Is there anybody able to give a qualified answer to Kevin there?
Chris has actually just arrived in the meeting, Vic.
Say that again, please, Michelle.
Chris has actually just arrived in the meeting. Not to put
Oh,
on,
right.
that's, if he's given a little bit of time, might be able to come up with an update.
Shall I go on to one more for Leslie a second?
Yes,
then, Vic?
yes, please.
Leslie, may I just ask on pack that's 8, 9, 10, the under directors briefing, it's there's nothing mentioning of winter plan was mentioned, and the last time when you mentioned about it, you very kindly said there were 2 things Baines were focusing on, which was the checking the everything complied with the Care Act and ethical framework, and the second thing was looking at the lived experience and engaging with local people. There didn't seem to be anything in your report following today, so just wondered where you're up to.
Thank you, Kevin. With regard to the people with lived experience, I have been in contact with Virgin Care Citizens Panel, but to date we haven't organised a date yet to meet. We have got it down on our agenda for the next meeting that I have with the direct payment and disability service user group, which is coming up shortly. And we have been in contact with AWP people with lived experience, but again, that meeting hasn't taken place. So those are both trying to be scheduled, but haven't occurred as yet. In relation to the Care Act easements, colleagues in my team did speak at the community hub meeting that we have every Thursday to try and go through that. And we have been raising that when I've been to the care home forum and to the home care forums. And yesterday I had a session with Health Watch colleagues actually, and we referenced the easements but didn't go into the detail of them. So there is still ongoing work to do with that. But it is a journey that we're on, and we will just be continually trying to state what the Care Act easements are. Every week now, I've put in place meetings with my team, and we are reviewing all of the intelligence that we get in relation to all the provision that's out there and the impact of the new variant. And at every one of those meetings, we're looking at whether any easements we think have been enacted, and to date, we haven't put in place any of them, other than those requirements needed for social distancing. So we are confident at the moment that we aren't putting any of those in place, but we're keeping an eye on that, Kevin.
Okay, bless you. Thank you. Vic, is Chris now there, or?
Yeah, Chris, are you there?
Chris, just a quickie on the pack page 7, 8, 9 under the music service. Just wondered if the AP Benson report, the second one, has been coming out, or whether you're going to bring it to a future panel.
Thank you. Apologies for delay of getting with you. It came out just before Christmas. It's going through a process of feedback, so there are a number of people who contribute to it, and we're just providing our feedback in the report, and then once they've done that, hopefully they'll provide us with a report that is, how can I say this, a little bit more accurate is probably the best thing I would say. And then when that's available, I'll be working through that with the steering group and with the staff, and we'll be looking to make some decisions about permanent arrangements in terms of the way forward for the service, which I'd like to reassure people is very much about having a local service.
So great. So that'll come up at a future meeting, Chris. Thank you. Thanks, Vic, for the
Okay,
that's the
thank you.
23rd one.
Paul May, did you want to ask a question?
No, not at the moment, thank you, Chair.
Or you were on the MIS, that's all.
No, that was the declarable interest. Sorry, Vic.
Okay, right, yeah, I got you. So on page 20 or 52, whichever you choose to refer to, I was asked as the chairman to write to government about the supporting of continuing free school meals. Before I could actually engage in that process, the government changed their position, so I actually didn't do it because I didn't feel it was necessary. And it would only undermine ourselves if we've done something that is already, requested something that is already done. So are there any more matters arising?
One by Vic, please.
Yes, certainly.
Sorry, that's on the minutes for the 3rd of November and pack page 24, one for Chris. Just wondering if there's anything for the SSB around update on information coming with that task subgroup working with the RSC office about disadvantaged pupil performance. And the second part of that was also about, on the bottom of that page, the inclusion expert and whether that again is on hold because of COVID.
Hello, yes, we did. We've got a subgroup of the School Standards Board, which is looking at the disadvantage gap. We actually met just before Christmas, sat down, and we've agreed some work we want to do with all schools. So we're just working with the CEOs at the moment about how we collect data and how we set collective targets for all of us to achieve for those schools and disseminate best practice. We were due to meet again after Christmas, but we've kind of just put a little pause on things because it's been a little bit busy in the world of education at the moment with other things. Secondary schools got a little bit bogged down with setting up maths testing sites, and primary schools have been a little bit busy as well. But the work that we were doing with St John's is underway. In fact, some of my primary colleagues are meeting with St John's now to look at the work that we're going to do with them around the disadvantage gap and the 8 schools in Baines. The inclusion expert, I haven't got an update on that one. I will get an update from Stephen Luke, my school improvement advisor, who's working on that particular project.
Thank you.
Okay, thank you. Any more matters arising, or are we all clear now? Yes, Ruth.
Just a short thing to say that, Sean Walker McAllister is, I hope, still going to send me some information about the 2 campaigns, Got Your Back and Never Okay. Just that I asked for some more information that hasn't arrived yet, but I'm sure it will soon. So I'm looking forward to receiving that.
Okay, can that be confirmed that Ruth will receive that?
Yeah, sorry, it's Leslie here. Certainly, Ruth. Sorry, Sean has sent it through, so I'm just a bit. So I will make sure that gets forwarded on to Mark.
All right, thank you.
Okay, thank you.
Okay, thanks very much. Then, so we'll move on now to item 7, cabinet member update. So, Rob or Kevin, which one of you are we going to take first?
Shall the junior go first, Rob? Yeah, off you go. Thank you, Chair. Thank you. Good morning, panel. You've all received my reports. You've got loads and loads of reports to get through today, and some really interesting officer work. So I'll instead of reading it out, Chair, if it's okay, I'll just take questions.
Right. Any questions for Kevin then, please? Right, Kevin.
I think you're on mute, Kevin. Sorry.
Sorry, I must have tapped it twice. On the free school meals, there's a lot of things about grants coming through from government to council direct and other things happening on the ground with schools. Are you coordinating with schools, or schools coordinating their own now provision with free school meals and vouchers?
We've been coordinating with schools. Good question, Kevin. The next government free school package, I believe the schools are doing that directly. Is that correct, Chris? Yeah, that's correct. Yeah. So the new tranche of vouchers that are coming out, the schools will be dealing with central government themselves. Although we are looking, the government haven't confirmed for Easter yet, so we're doing some internal work to look at how we might cover that gap if government don't step in.
Great, thank you. And the IT support, primary schools were told, at least the reports I had from them, that the IT from the government was on hold. Has the local authority got any further news on how they're assisting with IT? Or is that still very much down to the schools and the government direct?
No, I can pick that one up if that's all right. I've just come off a meeting with the maintain heads actually, and they've all started to receive their equipment now.
Fabulous.
It's taken between sort of 3 and 5 days for it to turn up, but it is coming through, which is good. So I'll make the assumption that applies to all the other academy chains in terms of primaries. Secondaries, I believe, ordered theirs much earlier, because as you'll know, that they were supposed to have a staggered start, so they had an opportunity to apply for those earlier. It's very much the responsibility of the DFE to provide that IT. So the role of the local authority will be around making sure that we identify or find it, have a place where parents can contact us and say we haven't got access, and we'll do that work in terms of contacting the schools and making sure they're all ordering their IT equipment.
Great.
So that's the work that we'll be doing.
And Vic, there's just one more last one, which is the connecting, because in all these situations there tends to be vulnerable families that sometimes don't quite on the free school meal qualify for those, but they're vulnerable. How does the council, Kevin, sort of connect up these vulnerable families that may be falling between two stools with sort of provision for either food or anything else that they may need?
So it's a very good question again, Kevin. So over the Christmas period, we did have a little bit of leeway for schools and community centres to identify people who weren't quite in that bracket, and we were able to support them. I couldn't give you exact numbers of those people who did claim that weren't actually entitled to free school meals, but we were 100% gave scope to officers to give that leeway. Unfortunately, with the new free school central government voucher scheme, obviously they're far more stringent than we would be locally. So I couldn't guarantee that the support would be given to those people. However, if schools and community centres do identify these people, then they're more than welcome to contact the hub. We have a range of services that we could help them with.
And do the schools all know that?
Chris, you've relayed that?
So yeah, we have. So we push information out via a number of ways, both via our public health team who send information out about a variety of different things, including the hub. But we'll be putting some more comms out today, which I've just been completing, which should be around the free school meals, the offer generally from schools, but also with the hub number, so that they can point parents that way. And there is some fantastic work happening in the food poverty group and with organisations on the ground who are really going over and above. And I have to say, I had a conversation with some of my schools earlier in the week, and I emailed all the multi-academy trusts as well. And there's some great stories there. And I know that free school meals has made the press a bit recently and some negativity, but there are some fantastic stories of schools in Baines going above and beyond in terms of supporting families, including a lovely one from Three Ways where some of the staff dressed up in fancy dress and went out and delivered food parcels and vouchers and IT equipment to families' homes. So there is some great work happening on the ground.
Thank you very much.
Okay then, Liz.
Hi, Kevin. Unfortunately, at the critical moment, my screen froze. And so I wasn't able to hear your reply about making sure that free school meal children have vouchers during the Easter holidays. Now, I know we're committed as a council to providing free school vouchers during the February half term, but that's from the COVID-19 fund. I do realise, thank you, Marcus Rashford, there's a lot of pressure on the government to perhaps carry on giving free school meals as with the universal credit £20. So I'm just wondering, are we making any plans to make sure that our children on free school meals will have these vouchers over the Easter period, or are we just relying on the government to have a good heart and to provide these?
We'll be very hopeful for the government to have a good heart, Liz. That'd be wishful thinking. No,
Melissa,
there's a two-pronged attack. Sorry, I won't be political, Chair. There's a two-pronged attack. The Easter period comes under a new financial year. So I've been having conversations with Richard Samuels, who is obviously the cabinet member for finance, to see what we can do. Obviously, the winter fuel COVID grant covered our payments over the winter for the vouchers, which was excellent from the government on that one. So we're not just relying on the government to do a U-turn. We are actively doing some thinking behind what we could do if the government don't. So hopefully that answers your question.
Yes, hopefully. And then, Vic, if I could ask just one more question.
yes.
I'm very interested to hear about the internet connections being provided for families who are in need. And I think, Kevin, you've answered that to a certain extent. And I know that families can avail of this via other options. But when I made some inquiries, apparently infant schools, those at the early years foundation stage and on key stage 1, are not entitled to any of this offer of help from the government for digital access. And I just wondered, is the council aware of this, and are we doing anything to address this? Because infant schools are teaching remotely, so that there will be children out there who are disadvantaged and won't be able to avail of this.
It's a very good question. I know we're talking quite closely with Twerton Infant School Reference, helping Key Stage 1 kids. Chris, did you want to elaborate on that one?
Yeah, we are helping them and connecting them with local people who can support them around that. So if there is a particular infant school we're aware of which is struggling, I'm quite happy to work with them as well. I know we've got a couple of infant schools which are in the area, but I would hope particularly the ones who have joined large multi-academy trusts are able to draw on the resources that they have in terms of providing equipment. But happy to have any schools names who are struggling pinged at me to see what we can do to help.
Okay, thank you, Chris. Thank you.
Thank you. Paul May.
Thank you, Chair. Karen, I think it's really nice to see a comment in your report about the staff being fabulous. And I think it's important that the committee actually say well done to the staff, because this is the only chance we got to actually do that. So well done to them. Can I just ask a question? Because you and Rob are at the beginning of the agenda. If there's any political questions that come up through the papers, I mean, there's budgets and the whole range of issues. We've made some management changes in terms of directors. People have left the organisation. That's left some gaps underneath. There are, if you like, some political type practical questions to ask. Can we ask those afterwards, or can we perhaps just ask the question in the future whether the cabinet members should be presenting their reports a bit later in the agenda, so that if there are any issues that picked up, that we can raise those directly with the cabinet members, because it's unfair to ask those officers those types of questions.
Yeah, I know we deliberately try to avoid politics, Paul, and rightly so. So more than happy, I think Rob would probably agree with this, to take those political questions separately, and we can still answer them formally via letter if you want that way. But it's probably best. I think the chair will agree. Avoid politics. Is that correct, Chair?
I'm pleased with your answer, because I never want to involve politics in this panel. It's too sensitive an issue. The panel itself, I mean, not politics. Politics is another thing, but we don't want to politicise this in any way. If what I think Paul's asking is, in a non-political way, are there any deficits in the provision of management of the services? And if you as cabinet members, both of you respectively, can identify that, or you are aware of it and you want it to bring to the attention of this panel, then I don't think that's not inappropriate. Are there any more questions for Kevin? No? So, Rob, can we put you into the driving seat, please?
Yeah, thank you very much, Chair. Oops, hello. You've had a quite a comprehensive report, well, an update. It comes in several parts. It includes some input from our Director of Public Health, Dr. Bruce Lawrence. There's only one verbal addition I'd like to add to that. And following a previous cabinet meeting, there was quite a valuable question coming from one of our colleagues from the Labour group about the shared lives carers and about the support. Now, this is actually quite a small cohort of supporting people that look after people with learning difficulties. And although they are technically self-employed, and they wouldn't normally have been included within the support structure, because of the nature of the way they are funded through Virgin Care, legal advice was taken and there was a small amount of resource identified. And so these are actually being supported, or they're invited to apply for support on there. So thank you very much to obviously our colleagues in the Labour group for raising this. And I think there was a successful conclusion to that. Other than that, I'm quite hoping to take questions on the report submitted.
Thanks, Rob. Alison. Alison, you're on mute.
Oh, yeah, I was just unmuting. Right, thank you. Thanks for the report, Rob. I've just got a couple of questions. One relates to the new BSW ASD service. So that's a service for people on the autistic spectrum. And it seems to be saying that there's been a gap in other parts of BSW and a new service is going to be established covering BSW. Now I'm aware that there's been a fairly long established, several years, very effective adult autism spectrum service in Bath. And I'm just wondering, and unless that's changed, and it's a couple of years, I guess, since I left mental health services, but certainly it was very successful then. How is this new service going to interface with that? Is it going to replace it? Is it going to be additional to? So that was a question about that. And then my other comment was really just in relation to the public health report. I just wanted to say how well I think the local public health service has handled the COVID pandemic locally. And I just wanted to note that. I think, we have done really well, and I'm sure it's been no less challenging in Baines than it has anywhere else in the country, and particularly because we've got two universities and we know that they were, sources of outbreaks early on, and somehow the way that they've worked does seem to have managed and contained things very well. So I just wanted to make sure that my view on that was noted.
Well, thank you very much, and I'll refer to your second comment in a minute. In terms of the autism support in Baines, you're absolutely right. We should pride ourselves that we do work very hard to provide good levels of support there. And last year, the Autism Partnership Board was basically reinvigorated under one of our officers, Rebecca Potter, who's done an amazing job in bringing this together. In terms of the technicals and how that's going to interface with the BSW, maybe Leslie might have some more focused information on that. But certainly what I would say is that we certainly don't look to dumb down our service. We look to have other people's service rise to our levels and grow on that. Les?
I would absolutely agree with you, Rob, and thank you for bringing me in. So this is in addition to, and they're there to support the existing services that are there and to provide additional support sessions. They're time limited for people pre and post diagnosis. So it is supposed to be an enhancement to what's already there. For more information though, Debbie Forward is coming later on onto the call to present the paper on mental health, and Debbie manages, as well as the mental health commissioning, she does the learning disability, ASD, and also the physical and sensory impairment. So if you have more detailed questions, then please do ask Debbie when she comes on, because she'll be able to give you a greater depth of information on that than I can give you at this moment.
Thank you.
And can I just pick up your second comment now, Alison, and thank you very much. you're absolutely right. The public health team are possibly, well, they are without doubt a highly functioning group. They're not a large group in terms of the council, but they cover an enormous amount of work. I mean, many of the items on the agenda today obviously come from that area. And on top of doing all the support work in all these various areas, they're obviously the team that's managing all the COVID activity and understanding all the data that's coming through, understanding the messages coming from government and trying to break that down so we can actually understand it and give support. And they also act as a very strong contact for other partners, universities, schools, and everything like this in guidance on that area. So we should be really, really proud with the work that the public health team, and really I would want to extend that, because I think all of the people in the portfolio, and I'm going to embarrass Les here, Les included, are doing an immense amount of work. And when we first had the first lockdown 1 and lockdown 2 and everything like that, they were working hard and they were under pressure. But what I will say is they are really under pressure at the moment. There is so much going on. And in fact, only this morning, I've raised the question about making sure that we have adequate support, not only within the portfolio, but also for the leadership team, because they are valuable assets to the community, and we've got to make sure that we look after them. They look after us, and we have to make sure that they're looked after as well.
Yes, Rob, we should be very proud of the service that we've been given. We're certainly blessed. Paul.
Thank you, Chair. And I once again, I said it around children's services, but I think in adult services as well, it's important that the committee actually make a minute where they're thanking the staff for all their hard work they put in, because it really has been quite enormous. But following on from the public health, we're looking at the budgets in a minute. There's actually proposals to reduce the staffing numbers in public health. And I was a bit worried because it has done such a wonderful job, and I don't think the pressures have gone from the pandemic yet. And my first question really was to just ask, why that's being brought forward at this particular stage in the budgets.
Okay, could we deal with that within the budget?
Yes, I prefer that you did, actually.
Then it's the same question I had for Kevin, really. We can't ask questions later of that, but can I then, my second question, Rob, is we've got care homes. Have you got a situation report about vaccinations in the care homes yet?
I've had a very brief. Sorry, Les, do you want to come in? Yeah, I had an email exchange with the officer leading the vaccination for the BSW or the NHS side of things, and we're expecting a more accurate report by the end of the week to let us know where we are in terms of coverage. Because as you can appreciate, it's not an easy thing to do logistically, but we are doing well in Baines. How well we will know at the end of the week, and I will make sure that information is sent round to basically to all councillors where it is. But logistically, it's difficult because we're doing residents plus we're doing staff and things like that. But we're well on course.
That would be good, Rob, because then the respective councillors then can pass that on to their communities to give them some support in having that knowledge base.
Absolutely, but I always, when I send it around information, I do always ask that people treat it with care, because we don't want to set hairs running and raise unnecessary concerns, because the vaccination programme is possibly the biggest logistical piece of work the NHS have ever embarked on. And if you think that, less than a month ago, we never actually had a licensed vaccine, we now have 2 licensed vaccines. And in the Southwest, on my call at the tail end of last week, in the Southwest, 380,000 vaccinations have been given. On the Group 1 and Group 2, we were about, and the group one was obviously where the care homes, anything like that, it was just under 50%, and it was a high sort of 70% for the 85 plus. And now word is that the next two groups are starting to receive letters inviting them to book their appointments and things like that. So it is moving on. And if I had not a concern, but a focus, it will be to make sure that as we move through the groups, the previous groups get mocked up and completed so nobody gets left behind. And those are the questions we're asking those people involved to make sure and give us the confidence that that's happening.
Thanks, Rob. Kevin.
Vic, I haven't finished asking my questions.
Sorry. Yep.
Right, okay, but if you can make them succinct, please, Paul, because we've got lots.
And I'll try and keep my responses shorter.
I'll send one in directly to you in writing, Rob. But I did want to just say, but the communications that the council have done to councillors has been absolutely excellent. And that event that was organised last week was really, really helpful about vaccinations.
Paul, have you got a question that's relevant to the committee that all members should share with?
No, I'll put it in writing to Rob. Thank you.
Okay, then, Andy.
Can I just mention that our comms team within the council work very closely with the comms teams in the partner organisations to make sure that we do coordinated messaging.
Fine, good, and so we should. Andy, did you need to speak?
No, I'm fine at the moment. Thanks, Vic.
Okay.
One thing I would say though is gentleman Brian wished to speak a bit earlier about the vaccines. It might be an idea to call him in.
Brian. Oh, sorry, Dr. Bryn. Yes.
Bryn.
Yes.
Yeah, I can get onto it later. Just when Rob was talking about the projections and the care home, there's an expectation that all care homes are completed certainly by the end of this month and likely sooner. So I just wanted to come in on that. You know, there might be certain logistical issues around some, but that is certainly the expectation within Baines, and we're on course for that.
Thank you, Bryn. Michelle, did you need to come in? No?
Liz does.
Kevin?
Point of order, Vic. Point of order,
Yes,
Vic.
Liz first, Vic.
I've asked twice.
Oh, sorry, but you're not
That's
coming
okay.
up on the chat facility.
Oh, it's there twice. Anyway, thank you for allowing me to speak.
Yes, indeed.
Just Rob, thank you very much for the feedback about shared life carers. That's really good to hear. And like all of you, I do feel our public health team have been absolutely fantastic. And maybe as a committee, we say something at the end of this meeting about, publicly. But my question is relating to your report, Rob, and I'm really pleased to hear about this breathing space where people who are in debt are given 90 days to try and sort out a debt crisis plan. And I just wondered, is this for new entrants or is it for anybody who's receiving universal credit? Because it really is a very good scheme.
Yeah, well, thank you. It's quite an interesting question, Liz, because it has caused us a little bit of confusion because the title for the breathing space is the same as another initiative that's currently working with Bath Mind, but this one's specifically about the debt. Now, as I understand it, the guidance is still being worked up, and so I don't know if we've got the detail yet. And maybe Les, is that right? We're still waiting for that final detail?
Yeah, the guidance hasn't been published yet, Councillor Hardman. We are waiting for it to come through because there'll be a short implementation time as well for that. So as soon as that's out, we just wanted to give you the information that that it's been passed through as legislation. It's quite a unique piece of legislation, actually, in terms of what's being proposed. I think we're all welcome it. But in terms of how it's going to actually be applied, the detail will come out in the guidance when it's due. So we'll share that with you as soon as we know, because we'll want to do a briefing for you, because I know it'll be of interest to everybody.
And I have actually spoken to the chief executive of the Bain CAB, Les Redwood, and he's very much aware of it as well. So he'll be there, and his team will be looking to put any support in place on it as well.
Good, excellent. Are there any more questions for Rob? Right, Kevin.
Thank you. You mentioned under the headings of the care home bit, the insurance for care homes. We're hearing a lot of things about the difficulty with care homes and insurance cover for COVID and things. Is that any more news on that front? And possibly tied up with the finances around that is in section item 4, it's mentioned about the reassessing the fair price of care for home care and care home provision, and whether that's going to be putting a little bit more pressure on the care homes that they're already under pressure.
Okay, I'll ask Les to come in on that. My only comment would be that we are looking to support many organisations which are private businesses in many ways, but they are obviously doing service to our communities and things like that. So, but maybe Les has a little bit more focus on that part of it, on the insurance, and then obviously the other part of the question.
So one of the key areas, Councillor Burnett, what you'll be familiar with, that's been across the news actually, is around that lack of insurance that some providers have been able to get. But we have actually got a designated setting which we were required to get in place by the government in the middle of October. We got it on stream by the at the end of November, I think, and Dr. Brimbird will correct me if I'm wrong in that. But that setting has got the insurance in place, and it has been checked that it is valid insurance for that. So we aren't seeing any concern in our area, but certainly in other areas there are concerns around the insurance. We're mentioning it to providers every time we have the forums with them, and they will be flagging it with us. I'm confident they'll be flagging it with us if it's a concern for them. So I think we're okay at the moment. In relation to the director's report, then you're correct. We have put in 2 fair price of care exercises, one with home care and one with care homes. The care homes one is a repeat on one that we did several years ago, so that's not new to providers. And the home care one is the first time we've put something in place like that. The agency we've used has done a presentation to all of the providers so they can look at the detail that's been brought together, and we've shared that with them. And it's about that exercise is about us helping to benchmark ourselves and keep our pricing in line with what we should be hoping to be seeing. So it's part of our resource management processes actually, and we are supporting providers financially as needed through this COVID process. You'll be familiar, we've brought to you historically some of the financial incentives that are already taking place from the council, but this is part of our business as usual work with providers, and it's helping us to manage our care sector market. So it's something that most local authorities do at one point or another.
Thanks. And Vic, was Leslie, while you're there, the bit about commissioning work under public health highlights around early help services for children. What's that about? Sorry.
That's probably better for Mary to answer if she's got a possible update on that. I'm sorry to throw that to you, Mary.
Yeah, I mean, we, Children's Services, we work very closely with our colleagues in public health in terms of any of the recommission of early help services. And I am aware that that throughout the pandemic, that the commissioners have worked very closely in terms of the support of the services being made available to all of our families and our vulnerable families. I think, Kevin, if you wanted something specific, I could take a question away and ask our public health colleagues to comment on that.
That would be really helpful. Thank you. And Vic, very final one, if I may, just to ask whether Leslie had any more updates about the CP forum and Operation Encompass, which weren't in your report there.
No, I didn't have any further updates on that. Again, I thought there had been a response. I will check whether there had been a response sent to you. I had thought that had been done, but I will check, Kevin.
Thank you very much.
Okay. Any more questions for Rob? I can't see anything. There's nothing on the chat facility. So, Rob, thank you very much. I think we've given you a jolly good bashing. So,
thank you. And again, I'd just like to reiterate certainly my thanks to Leslie and her team, because she not only helps me understand the whole range of work going on, but also enables us as councillors to obviously relay that through to our residents. So thank you very much.
Yes, thank you. Thank you, Rob. So if we move on now to the Bath, Swindon, Wiltshire CCG updates, and if I can ask Dr. Bryn Bird to...
Vic,
Yes.
can I a question? Are we jumping on past Mary's report on children's services?
We're not coming to that yet.
Right.
Right, we're going down through the agenda as printed. So we're on item 8 now, the CCG update from Dr. Bird. So Bryn, please, if you can go ahead, please.
Yep, okay, thank you, Chair. So I take it the report as read, so I'm just going to very briefly highlight a few areas, leave plenty of time for questioning. So firstly, I'm sure there were questions on vaccinations. So many were at the meeting last week where some of this was addressed. 4 sites are up and running now in Baines and active and working effectively for cohorts 1 and 2, and we're due to be on course to meet the targets as alluded to earlier, so having care homes, residents and staff vaccinated by the end of the month. But for cohort to the over 80s, we're currently in around the mid 60% for that cohort, and again that should be completed certainly by the end of the month, all being well. And similar for our health and care staff as well outside of care homes. And for that we have the support of the RUH hub as the prime provider, although there is some scope obviously in the delivery sites to support that as well. So the RUH vaccination hub is up and running as well, and we'll be due to also get the support of the mass vaccination site, which is currently being worked on in the background. I think we're getting a lot of positive messages from patients and also from staff. Staff are very motivated in delivering this whilst also maintaining the normal routine and urgent care. So we're delivering the service. On top of that, very little is being stood down in primary care to deliver this, but we're also aware it's our #1 priority. I think for yourselves, it's important to recognise we're still using the push model. So we're certainly getting a lot of queries in primary care, and I'm sure a lot of you are as well, of when am I having the vaccine and certain queries. There is an email address included in the report, so you can direct residents towards that if you're unsure of the responses. But I think the overall message is it is a push model, and you will receive communications from practices, but then also for those on the border, say with Ashton Gate, there may be some national communications as well, which aren't in our control. The other thing is we're also in the background standing up a service for the harder to reach group, those with serious mental illness, learning difficulties, homeless, and those that sort of alternate between hostels. So that's been set up as a separate stream, which I believe was a question last week. So that is being worked on as well. So that's it for vaccination. Happy to take questions later. It's also important to recognise the pressure the RUH is under at the moment. Significant number of cases and ITU admission patients on ITU, much more akin to wave 1 of coronavirus rather than sort of autumn wave. That's a high level of pressure and putting on high level of pressure and expectation on services to get patients out of hospital to manage that capacity. That of course has its knock-on effects, and one of those is given in the paper that the MIU services at Poulton and Trowbridge have been stood down temporarily, and there'll be more communications to follow on that when they've been confirmed. It is only a temporary measure just to help manage that pressure in the system, especially within the flow around the acute hospital, but these services will be up and running again once that's been alleviated. So more communications to follow on that. Around COVID, a couple of the services that have been started up in the past couple of months to help support the pandemic. One is called the COVID Oximetry at Home service. Now this is designed to help manage those patients that are positive and in vulnerable groups to get help earlier. It was well recognised from previous care that late presentations to hospital carried a high risk. So this is a service that helps manage patients at home, looking at things like their oxygen saturations amongst other observations, and help making decisions based on that much sooner. And that's being used quite well across the patch, I understand from the data, and helping patients to present soon in the pathway, because there's a lot more care, a lot more proven treatments that can be delivered to these patients in the acute setting than there was in wave one. The second is called the long COVID service. So this might be a term you're familiar with, that's been in the media, and this is for patients that are suffering after effects despite fighting off the initial virus, including things like fatigue, joint pains, sort of mild breathlessness, and a kind of fuzzy feeling. And so not an easy patient cohort to deal with in terms of what we have available in primary care. So we've set up a communal service across BSW where they're triaged centrally, and then appropriate more specialised services are found for these patients if they're still presenting with symptoms after the 6-week mark. And finally, just briefly mention the plans moving forward around integrated care systems. So legislation came out at the end of November, and we as a system responded to that with initial thoughts around the options available and what it means to us as a health and care service. And the plan is to outline is to continue with the integration that's been happening in the background without legislation support over the past couple of years across health and social care, physical and mental health, primary, community, secondary care services, as well as the volunteer sector as well, with a view that patients aren't moving between separate siloed service, and we're managing as more like one system with combined resources, looking at more population outcomes rather than separate services, but for patient needs. So it's more about outcomes improvement rather than outputs, if you like. I think I'll leave it there and take questions, Chair.
Thank you, Bryn. Paul May.
Bryn, thank you very much. The integrated care system consultation could involve not only doing away with the CCG, but also our contractor Virgin by integrating delivery right from top to bottom. Are you actually worried that there might be implications like that coming out of this consultation document, and what sort of timescales are we talking about?
Okay, so the legislation is due to be acted in April 2022, if all goes to plan, if that's not derailed, but we obviously need to start working on that now and looking to set up shadow forms of the services within the next few months. As I mentioned, it does involve in the long term the integration of community services into primary and secondary services. So we're working together. It's to be concluded, but there's no look to be standing down any Virgin services in that time frame. It's a long-term plan, and I think you're aware of when the contract is due to be explored for renewal. We have to take what's happening in integrating care alongside that contract time frame and see what's best for that integration. In the long term, sort of 5-10 years, that will be looked to to be, as they integrated into those services. But in terms of the short term, we're not looking to pressurise that contract or chain or have any amendment to what is already existing.
Thank you.
Liz.
Dr. Bird, I'm really sorry to labour the point. Sorry about the pun. But you have mentioned that the minor injuries unit at Porton Hospital is being closed, and we can understand why, and it's only a temporary measure. But I know residents have asked me, and it's not just in Porton, but in the surrounding areas in North East Somerset. Can you reassure us from the CCG that this really is a temporary measure and that it will reopen when the time is right, obviously when some of the COVID crisis is over, hopefully?
Yeah, thank you, Councillor. Yeah, absolutely. There's absolutely no plan other than what's alluded to here, that there'll be any longer term measures around this. This doesn't reflect on any more strategic plan about the minor injury units. It's purely to help with those significant pressures I was alluding to earlier. Those staff are needed, unfortunately, elsewhere in the system at the moment, and managing minor injuries, unfortunately, is a lower priority at the moment, as I'm sure you can appreciate. So it's much needed, and comms will follow in the next few weeks on a time frame around
that. Okay, Andy.
Yeah, a very quick question. I've read in the media that there are some areas of the country that have had a few problems with vaccine distribution. Have you found the distribution satisfactory in our area?
So there's certainly teething problems. I mean, it's such a logistical thing to upscale this quickly, and there were teething problems in terms of when it was delivered. So delivery sites were having some concerns around that it'd be delivered on one day and it could be delayed and it would be completely out of our hands. And you can understand there's a bit of pressure there when you plan full clinics, perhaps stood down the normal primary care functioning for that. But in terms of the current flow from now on, that is not deemed to be a pinch point, especially with the second vaccine being licensed and AstraZeneca vaccines are now being delivered alongside the Pfizer one. So I'm certainly not aware of any delivery sites in Baines that are having that as a pinch point.
Any more questions for Bryn? I don't see any. Bryn, just one thing on the Ashton Gate. Will people from Baines be admitted to Ashton Gate, or is it specifically for North Somerset, South Gloucestershire and Bristol? Can we go cross boundary?
Asked to go for the vaccine. There are some borderline areas where I'm aware residents have been offered vaccination in Ashton Gate, but it won't. Those invites are out of control in the CCD, unfortunately, Chair. I think they come from more central communications, but yeah, it's not entirely limited to just local authority areas. It is based more on natural geography.
I see. Rob, you wanted to come in?
Yeah, I mean, the instances I've heard where people have been invited to Ashton Gate, and I can only assume that they're trying to obviously fill the capacity there. But I think when they get the letter, they have the option to contact their local GP to get a more localised venue and date. So it's not a given they've got to go there. And I think that's worth understanding.
Okay, that's good, because people in the Chew Valley, to go to Ashton Gate would be closer than going to a facility, say, for example.
Yeah, and that's recognised, and I believe those appointments are being offered on those borders for sure. And there's always the option of the delivery sites, but that's obviously in a different time frame.
Yeah, Andy, did you want to come in?
No, but I thought YK might have put his hand up. I could be wrong about that.
No, I just put the hand wrongly. I mean, I'm fine. I don't have any question. Thank you. And then I lowered my hand. Yeah.
Fine, thank you. Bryn, thank you very much. I think we're done with you, but thank you very much indeed. So we'll move on now to item 9, and that's the health infrastructure plan, the HIP2 update. And if I can invite Simon Cook to present the report, please.
Hello, good morning. Yes, it's Simon Cook from the RUH HIP2 programme. So thank you very much for making time for me this morning. Can I just check, Chair, will the slides be shared for me, or do you want me to share them? How's that?
Can you're saying that you could share the screen?
I can share my screen if, yeah, sure, if that's or will someone share the slides?
I'm going to go with panel response. Would you like to see the screen? There's some thumbs up. Yes, you would, please.
Yep. Okay.
So if you could share the screen, that would be appreciated.
Certainly. Yeah. Just do that. Okay, is that visible to everyone?
Yes.
Yeah, great. Okay. So this is the contents I want to cover today. I think these slides were shared prior to the meeting, so I'm going to go through relatively quickly just to allow time for questions, Chair, if you're happy with that.
That would be good. Yes, thank you.
Yeah. Recap for those who are new to this, a big part of the current government's manifesto 2019, Boris's 40 hospitals. That comes in 2 phases, HIP1 and HIP2, that's Health Infrastructure Plan. We're in the HIP2, and we're very fortunate to be one of only 21 trusts within that. It's not just about investing in new hospitals, it's also about investing in technology, which is increasingly becoming important as part of our infrastructure. These are the other trusts in the Southwest. The Southwest has got a disproportionately large slice of the HIP2 scheme, so that's good news for us. And the figure that we've been invited to bid for is in the region of up to 450 million. So it's a really significant opportunity for us to seize. Overview of the plan. This is slightly updated from when I last presented at this forum, which is back in September. So we've refreshed this slightly. I'm not going to go into too much detail here, but effectively the punchline of this is that in December this year, we want to submit our strategic outline case, which is the SOC. That's the first of 3 business cases that we'll need to do to get the investment secured. We've been working hard at that since last summer, and we're very keen to, if we can, submit the strategic outline case even sooner than December. The reason for that is that the uncertainty, the economic uncertainty, and the sort of turbulence that we're currently experiencing, we think our best interests are served to put in the case as soon as we can, as soon as we can get a coherent story there and a strong, compelling case to secure the funding. It comprises of 5 elements within the case, which are the coloured bars you can see there. The most important of those is the strategic case, which is the case for change as to why we want to do this in the first place. And to inform that, since we last met, we've been working hard developing some clinical options and clinical models and a clinical vision, which I'll share some of that with you just now. So the thing, I know once a generation opportunity really is a cliche, but I couldn't think of a better way of summarising it, to be honest, because it really is the scale of change here. For those who are familiar with NHS buildings, they tend to be to last a lot longer than they were intended. So the buildings that we're building now in the next 10 years may well be there for our children's children potentially. So we've been working significantly with our system partners to start to develop the plans and the vision, which I'll share with you shortly. I think the other thing here is the investment we're talking about, which will be principally made between the next 5 and 10 years. That's the build programme. Clearly will be much needed investment, not just for the NHS, but actually to the local economy, which is becoming increasingly paramount as we hopefully exit COVID. The exciting thing for me is that this is very much a catalyst for change in how we deliver health and care. And when we ask questions of what's care going to look like in 5-10 years time, it forces us to really be bold and consider that future model of care there. And with Dr. Bird and colleagues, we've been starting to do that, recognizing the opportunities we've got now with more digital platforms, people, population and clinicians alike, recognizing a different way that we can do care in the future. So we're really keen that for your support as to how we can seize this opportunity to bid at this stage for this investment. Okay. This is a summary of our ambition, which is very much focused on outcomes for patients. You can see there. You notice we haven't talked about buildings and that, because the first thing for us is to think about how do we want to deliver care, and then what buildings do we need to support that, and what digital investment do we need to support that. Here's the clinical vision model of care that's been developed with partners across the BANES ICA, Integrated Care Alliance. So thank you for everyone's input to that. It's been really helpful. A big focus on prevention. They're moving to health and well-being rather than simply responding to patients when they're sick. I mentioned a population health approach, using data in a much more sophisticated way to identify early patients' onset of symptoms or deterioration. We're looking to work much more seamlessly across health and social care, so much better integration, moving away from the sort of stovepipe organisational structure we have more today. And this to be right from the start of someone's life all the way through to end-of-life care. And of course, we'd want to really improve the urgent and responsive service for patients who are acute, who need a very quick response. I'm not going to go in great detail on these because some of these are quite technical, but what I would say is these are the investment objectives and critical success factors, which in the strategic outline case, we will use to evaluate what are the best options to go forward. And we have here a mix of things that are really important, principally for the patient care, but also looking at other aspects such as for staff, the best options for those, and also our estate, and particularly the environmental agenda. So the net carbon zero agenda, the NHS is very serious about playing its part within that, so having a sustainable estate for the future as well. So these objectives would be used to evaluate that, and similarly these critical success factors will be in the strategic outline case as well. Happy to take any comments on those at the end. The first part of the HIP2 scheme is actually the Cancer Centre, which has been developed for a while. Out of the 450 million that's potentially available to the Trust, 42 of that will be used for the Cancer Centre, and the rest being made up through generous charitable donations. So those who are familiar with the site, as you come in the main entrance on the right-hand side, there's hoardings, and behind that there's been a lot of clearance going on, getting the site ready. And we're just now waiting for final approval imminently for construction to start next month. Which is really exciting, and that's due to open within 2 years' time. So will be a far improved, high quality experience for both patients and importantly for staff as well. So that's the first part of our HIP2 scheme, and then the next thing to follow that after that will be we're looking to our alongside midwifery unit, which will be integrated with care within the Trust as well. So that's another development that we'll be looking to after the Cancer Centre. So these are the first fruits, as it were, of the HIP2 programme. But and in parallel with this, the main effort, we're defining the future requirement, as I say, in our strategic outline case that we're looking to submit this year. terms of engagement, so we're really keen to start to ramp up the engagement with in many respects here, and we're developing a engagement plan, which will be quite broad, checking and gaining views from local population and key stakeholders to inform our options we're going to develop, and to also inform the appraisal of those, and to making sure that what we're developing here is something that fits purpose for the long term. I should emphasize at this stage, of course, it's going to still be very strategic, because we won't be talking about individual buildings and the layout of those. That will follow over subsequent business cases as we get more detail. But we do want to particularly focus on the model of care at this stage, ensuring that our proposals are based on a model of care that's fit for purpose and works for the local population. So next steps, we're going to develop that plan and then deliver that. We're going to continue to work with system partners to develop the clinical model in more detail, so exactly what that looks like, and how we then deliver that. And we'll be turning some of our strategic options around the model into estate solutions, which we will then evaluate in our strategic outline case. I say this is about a balance of getting something that's directionally right, but won't be completely precise because there'll still be some unknowns, but getting a business case in soon this year, so that we're at the table, and we're in the running to secure the funding. If we wait to get it perfect, well, everyone else would have gone past us and a bit of money left. So it's that getting that trade-off. We want to work with you to make sure we've got the right balance. Thank you, Chair. That's all I had.
Thank you. Can you return us to? Thank you. Excellent. Simon, first off, the submission is to secure up to 450 million. So there's a vagueness about that, because that's the cutoff, isn't it? You know. And ideally, we'd like to think that you get the 450 million per se, and away you go. So it's going to be assessed on what your submission is as to how much you get.
Yes, I mean, there are lots of moving parts in this. So the first thing to say is that it's unprecedented in the NHS's history to have had such a whole-scale investment at one time. So capital investments, new hospitals have been very much sort of ad hoc over previous decades. So we're looking at this time is a national program of investment. So with the 40 hospitals, the complication of that is that there'll be some trusts who might have more compelling cases. Some trusts might have less compelling cases, and the actual amount of money in some respects can be quite arbitrary. So the 450 million has been allocated to us, but there's no particular maths that I'm aware of behind it. The way we're seeing this is that our focus is to make sure that what we're asking for is something that's evidence-based, that's based on a robust clinical model, that's the right thing for our population, that tackles the needs of the estate. So that there is a significant backlog of renewal required on the Coombe Park site that needs to be addressed. And we're keen to put a case that is as compelling as possible. We see this, I guess, to some extent, as being a competition. Right. So we have no complacency at all about the 450. There's nothing definite about that.
So the better your submission, the more likely you are to be successful.
Yes, but also a timely submission.
Right.
And so
a difficult balance.
Yes, yeah, because the central I think what I would be fairly confident in saying is that the demand for money is probably going to exceed the amount of money available. So the sooner we get to that table with our strong business case, the better. Yeah.
So in your presentation, you actually say that you very seriously want to play the part in building a net carbon zero estate footprint by 2030. No, that's a commendable aspiration, because the NHS produces 5.4% of the UK's greenhouse gases. And to give you an idea of what that might be, it's more than the aircraft departing from Heathrow annually. So it's quite a big greenhouse contributor. And I did look into something, and surprisingly, when surgical patients breathe in anesthetics, they metabolize only less than 5% of the anesthetic gas. Mostly it's unchanged and pumped out into the building, into the atmosphere as a greenhouse gas. Now, there are moves afoot to recycle this, to capture it in canisters and reuse it. So there's a huge saving to the NHS and a huge saving to our contribution to carbon zero as a country. Now, are you endeavouring to introduce that into this new build, a scheme of that kind? Because I would see that as being meeting favourably with your submission. And also, are you working with the council? Because the council are bringing a paper to council later this week, to full council, on how its response to climate emergency. And I believe that the RUH and the council could work together to make a huge contribution to climate change in this locality. And we could be amongst national leaders, which is what I would endeavour to promote. Yeah, so firstly, I'm aware of the greenhouse gas with anaesthesia, and it's certainly something which which we'll be looking to minimise that. I should say it's an aspiration to get to net carbon zero across the site, and to be fair, how that's defined is still being developed anyway. There may well end up being a system of trading carbon within a local area as well still. But any new build that we have on the site will be net carbon zero requirements of those buildings. We've appointed energy advisors and consultants who have expertise in the net carbon zero agenda to advise how best to impact that. We're looking at potentially changing the energy supply to the site as well. I'm talking about Coombe Park here, which currently uses steam, for instance, to distribute energy around the site. So we're looking at what it would take to move to electrification of the site, which then enables us to buy green energy to achieve net carbon zero that way. So there is genuinely a very strong desire to develop that. The other thing is that the model of care becomes very relevant here as well, because we're keen to minimise the amount of journeys patients need to make unnecessarily to an acute site, to something that they could be delivered for them at home or in the community. So we don't want people coming into outpatient appointments that could be done equally well through a medium like this, online or not, or even not at all. And each of those journeys obviously impacts in terms of the carbon. We're taking up car parking spaces, we require bigger buildings to house more waiting rooms, etc. So there's a very much a synergy between getting it right for the patient and actually reducing our impact, because the best way we can reduce our carbon emissions is to reduce the numbers of meters squared, effectively the size of our estate at Coombe Park, by getting that model of care right. I'd be very interested just to check that we're talking to the right people at the council chair, just to make sure we've got those connections. I know my colleagues are, but I just want to check. So I'll certainly perhaps offline check with maybe Mark, make sure we're talking to the right people. So we're working together on that. But thank you for that. Thanks, Alison.
Thank you. Hi, I've just got a few questions. Really interesting presentation, and good to hear that we might be getting some more money in the local health community. The first one is, are all the trusts in the Southwest bidding for the same 450 million, or is it a bigger pot? Because obviously the size of the pot.
Yeah,
Sorry.
yeah. No, it's a bigger pot. So I don't know what the actual allocations are for the other 6 trusts in the Southwest, but we're not all competing over for the same 450.
Right, well that's reassuring to hear.
Yeah, yes.
Okay, and then I just had a question about when you expect to have your health priorities identified that you're going to be, aiming to address through this different model, and what's going to be the process for identifying those priorities. And then my last question is just in relation to the COVID pandemic. And the NHS for years has been reducing its bed numbers. And in a way, I think those chickens came home to roost with COVID, because actually we discovered that we're underbedded for a pandemic. Do you think that that's going to change your thinking for the future shape of the service?
Thank you, Councillor. So I think yes, it's a really good question. So in terms of the health priorities, that's not something for the RUH to determine in isolation. It's something that we need to develop with partners in the system, and we want those sort of reiterated and clarified within the strategic outline case. The BSW plan, long-term plan, which was published last year, sets out priorities, and we'll be making sure that we are aligned to that population health agenda, because there's a risk here that we get 450 million quid and we think, right, great, let's just start building stuff and replacing our buildings, but actually we want to absolutely start with what we need to achieve for health outcomes in the population, and then work back from that. And that's been very much our approach to date. In terms of so just one moment, your last question. Sorry, I've just lost my train of thought.
Yeah, so it was about the fact that the NHS has been
the beds. Yes, thank you.
Reducing bed numbers for years.
So yeah, thank you. Yeah, so there's been a big drive. The narrative has been over the last of 10, 20 years of needing to reduce bed base, as you say, to shift to care in the community. Certainly that's been challenged by COVID. The other thing that's been challenged also, though, is staffing, because the main constraint at the NHS moment is not beds, it's staff. We have Nightingale hospitals, but we haven't got the staff for them. Where we needed to use those for the intention they were designed. So it's about resilience, not just from a bed point of view, but from an overall capacity point of view. It's a really interesting challenge, because on the one hand we want to be really productive and efficient. We don't want to be wasting resources and having unnecessary beds, but at the same time we need to be able to respond. So that's tension we'll need to consider as we develop the business case. Unfortunately, the dynamic has been historically is that if there are lots of acute beds, they will end up being used, and the problem for that is that's typically not good for patients, because the longer they spend in hospital, the more likely they are to spend in hospital and to pick up infections, etc. So it's generally in patients' interest to be in hospital as little as possible, which is our whole strategy of wanting that care close to home. So it is a tension we recognise. And I say it's broader than just beds. We'll need to look at the staff as well. Yeah.
Okay, then, Kevin.
Thank you. 3 quick questions, if I may. The first one was that given that you do have to eliminate backlog maintenance, which I quite understand, how much do you roughly think of that 450 million bid is going to go into this maintenance bit, and how much is going to be for future priorities, as you put it? The second question, I have to apologise, my wife's getting that phone, which is annoying me. The second question is the preventative bit. Is our schools and education? I mean, in the 2000s, we had a wonderful system of Every Child Matters, which had education, health, and social care all working together. We seem to have lost that, and it seems to be very sort of piecemeal and disappeared in the ether. And for your prevention, I would have thought that education must be key to one of your things that you're going to do there. And what might that look like? And tied in with that, the Wellbeing campus, which is my third question. What on earth are you envisaging there? Is it going to be a big gym? And are we all going to be sent there with a doctor's prescription, or are schools going to spend, you know, an hour each day rotating through the system just to make sure they're fit?
Right. Okay. Thank you for that. So, yeah, let me just take this then. So, firstly, in terms of the prevention agenda, absolutely, that's got to be the way forward. We are looking at education in schools. So our clinical lead on the HIP2 program, very passionate. He cycles to work to 10 miles each way each day. He's very passionate about getting into that health and well-being. And your questions are linked there, of course. That we are the education, the way we're interacting with healthcare, having to have fewer cars on site, more public transport, people walking and cycling to work as well. And actually, the other thing I'd say on prevention as well is we're looking to use data better as well. And I think in all of our lives, that's happening more and more. We're getting nudged into keeping fit. I mean, I've got an app that reminds me if I haven't been for a run for the last 2 days, and gives me a bit of a kick, gives me my stats and so on. And we can use more and more of that at a population level to target and intervene in a whole variety of ways in terms of lifestyles, but also in terms of conditions as well. In terms of the health and wellbeing campus, that's something which it's a really good question, Kevin. And at this stage, it's very strategic. We haven't got specific solutions on that. One thing that has become apparent, though, is that a key thing is actually the health and wellbeing of our staff as well, because the nature of care on the acute side it will become more acute, because the less acute patients we're looking to have care close to home, that's going to leave an increasingly concentrated cohort of patients on site, very acute. And I think we've all seen in the media, I've got colleagues and so on who are experiencing the pressures of that acuity clearly at the moment, which hopefully is not going to be indefinite, but it's an example of the pressure on staff. And so having on site the facilities to enable staff to recover, to rest, to have good downtime is going to be really important as well, actually, and to model to patients that healthy lifestyle. Your first question about the backlog. So the backlog maintenance figure is we're having a survey where results will come out imminently, which is a more precise figure, but it's in the region of the 50 million. It has been identified of what it would cost to bring the estate back up to a good level. Condition B is the state's term for it, which obviously is a relatively small proportion of the 450. The smart thing for our healthcare architects to do is to make sure that we're not spending money on bringing a building up to date, which actually we don't need the building anyway. And so if we can remove a building which has got a lot of backlog maintenance in it altogether and replace it with something that's fit for purpose, then that's a better use of the money. So we've got to work through those things to optimize the value of the estate. So every pound that we're investing is having the best impact on a whole range of things in terms of fit for purpose for quality care, the environmental agenda, and providing a high quality estate. My vision, if we get this right on the RUH, we'll end up with a relatively small estate, but highly productive and high quality as well. And there's plenty of opportunities. And the RUH is by no means unique in this. There's plenty of opportunities to use the existing estate much better than we do now.
Thank you, Simon. Paul, we're way over our time now, so if you can be as succinct as possible, that would be appreciated.
Okay, I want to make a proposal, Chair, if I could, from the floor. That the committee, because Simon asked the question whether this is the right place, we're a policy development committee, and therefore I think we are appropriate to the bid that's being made. So I think the committee supports fully the case for investment into the RUH via the infrastructure plan. I think that would be a positive note for the hospital moving forward.
Yes, that's a good point, Paul. And also the fact that the RUH are engaging closely with this panel, it's to the merits of their application. I think it will be received well by those that are allocating. So I'm going to suggest that
I'm happy to second that, Chair.
Simon makes this as a regular agenda item going forward until such time as the bid's secured. So if you give us a progress, it doesn't need to be as so comprehensive as this, more of an introductory scope that you've offered today, but just something to keep us in touch, and so that it can be recorded that you continually have been liaising with this panel. It might be a good measure. So does that meet with the general support of the panel? I'm seeing nods all round, just scanning across. Yes, it does. So thank you very much, Simon. And we're bringing your...
Thank you, Chair. And I could just express our heartfelt thanks to the support for this panel, because this is a competition nationally. That's the way I'm seeing this. And I think it's only together that we're going to be able to secure the funding. So thank you for your time today.
We're in it to win.
Thank you.
So look, we're actually 20 minutes behind schedule now. So would the panel like a 5-minute break now, or do we want to carry on?
Please.
I'm getting thumbs up for a 5-minute break then. Okay, so we will resume in 5 minutes prompt. Okay, thank you. Marcos, you're at the Ah, yes, I stood on you, didn't I? Hey, I stood on you, and I horrible to you, mate. Hello. Ah, right.
Hello.
Hello.
Okay then, so back onto the agenda. Right, agenda 10 then. It's the mental health strategy for Baines, Swindon and Wiltshire, together with response to COVID. And if I can invite Debbie forward to introduce the report to the panel, please. Debbie?
Thank you, Chair. Can you hear me?
Yes, indeed, yes.
Okay, I'm just checking because I've got a bit of a dodgy connection this morning. Thank you. Just to say that I'm joined at a panel today by two of my Baines commissioning colleagues, Lucy Kitchener, who's going to help me present the report, and Neil Manson, Mental Health Commissioner, who'll be on the call to help answer any questions. I'm sorry it was such a beast of a paper, but I think that's a reflection of all the huge amount of work that's currently going on in mental health and the fact that it's such a large area. I won't talk through the paper in detail, but I'll just highlight the progress we've made to date since the last mental health review, bring you up to speed with new developments, and talk about the impact and the response to COVID. Then I'll hand over to Lucy, who will cover the sort of main bits of planning that are underway in terms of some major transformation of community mental health services that are planned across Baines and the rest of Baines and Swiltshire and Windon. Obviously, a lot has happened since the last mental health review. An all-age mental health strategy is being co-produced, which covers Baines, Swindon and Wiltshire. And that is actually based on the Thrive model, which was a recommendation of the mental health review. And that Thrive model has some key elements in it, which is enabling people to stay well. And for children and young people, that's enabling them to thrive and cope, getting help when it's needed, targeted support, getting more help when needed, and managing people in crisis. So that Thrive model really should help us deliver early help and intervention, and links in very well, I think, with the early help and intervention, early help and early intervention work that's happening in children's services around the strategy at the moment. And I think it gives us the tools to help prevent people being admitted to hospital unnecessarily. But I think it's going to be a bit like conducting an orchestra, bringing all the different elements into play at the right time and at the right place. I think the model will help, but it's going to depend on how we implement it locally, and it will hinge on good collaboration between the whole range of services that develop health and emotional wellbeing and mental health services, stretching from health visitors to children's centres, school nurses, healthy schools, a lot of the third sector services that we commission. So I think it's going to be, I think the model puts us in a good starting place. It gives us the tools, but I think it's actually going to hinge on how well we implement it and how we monitor to see if it's reducing the number of hospital admissions and preventing people's needs escalating, and about how we measure that impact. So we know it's making a difference. Do we see the numbers of hospital admissions going down? And what's the feedback from people, children and young people and adults with lived experience? What sort of difference is that model making on their lives? So I think the model will help, but a lot of it's going to depend on how well we work collaboratively together locally to bring about those changes. We do have a place of calm, which has been developed in Bath now. It's called Breathing Space. It's run by Bath Mind, and that will provide practical and emotional support to people in a non-clinical setting, usually at a point of crisis to help people's needs escalating. Obviously, because of COVID, it hasn't opened yet for face-to-face support. It's still running as a telephone service, but I think they are planning on opening now in early April. The Wellbeing House in Bath has been operating successfully as a sort of step up, step down facility during the pandemic, and it's been open 7 days a week. That has proved to be very successful at preventing hospital admissions, and that's a model we would like to continue in the longer term in Baines as we move forward. And we're in the process of looking at how we can get some additional resources to support that. There are also a number of other service developments underway in Baines, and the main ones to note is the expansion of the IAP talking therapy service, the expansion of the eating disorder service for children and young people, that's sometimes called TEDS. And hopefully early this year, we're going to start to pilot a new home treatment service for children and young people, which will be welcomed. Now, these are areas where services have been stretched in the past, where we know they need additional investment, so it's very welcome. Obviously, it's a bit of an awkward time at the moment to expand services and recruit staff. And obviously, I think we can note that the pandemic is starting to hamper that progress a bit. And COVID has had a huge impact on both individuals and families and services alike. Mental health services across all sectors and all ages in Baines have regularly reported that there's been an increase in the severity and acuity of the mental health needs that people are presenting with. And I think if you look at the CAM slide, you can see that trend, particularly around eating disorders. And that's been seen in Baines particularly, but also across BSW. More recently in Baines, we've seen particular issues affecting children and young people as they return to school in September, increase and heightened levels of anxiety as children have returned as a result of the pandemic. But what we have done is we've used some funding from the CAMS transformation plan to enhance the level of support currently provided to those young people, and provided additional funding to Youth Connect and Off the Record to increase the level of services and interventions they're able to deliver. We've also seen more recently an increase in referrals into secondary mental health services in Baines, into both sort of social care and health. And we're now working very close with AWP to bring in some additional resources from other areas of the trust to respond to those increased levels of referrals and waiting lists, to bring those down. So in response to the pandemic, a number of things have happened that have impacted in Baines. 2 24/7 helplines were set up, put in place across BSW, one specifically for young people and one for adults. The young people's one was run by Oxford Health and the adult one is run by AWP. There's also an additional helpline in Baines, which is run by Bath Mind from Breathing Space, and that operates mainly in the evening. And those helplines have proved to be very effective at helping prevent people going into crisis. So the intention is that those 3 helplines will be retained after the end of the pandemic as a part of our solution to trying to prevent people going into crisis. Locally in Baines, you'll probably be aware of this, but we've seen the development to the Community Wellbeing Hub, which provides a single point of access for people seeking help in Baines. And that includes access to mental health wellbeing, again, which is led by Bath Mind. As you can probably see from the report, there's been a huge amount of good activity since that hub opened in April. Most of the services in Baines and across BSW, voluntary sector and statutory, all ages, changed their model of delivery during COVID, particularly starting off in the lockdown, and moved to a more virtual delivery of interventions using telephone lines and digital responses. Unless, of course, there was a clear clinical need for somebody to have face-to-face. And that seemed to work quite well. And there's no evidence as yet to say that that's less clinically effective than face-to-face models of delivery. In fact, I think it's fair to say it's enabled many people who find face-to-face interaction quite difficult, or who might find it difficult to leave their home to go and get services, to access interventions and support they probably wouldn't have otherwise done prior to COVID. And going virtual and using telephone lines has enabled many services, particularly the third sector services in Baines, to reach more people and provide more support to greater numbers of people in this way. I think as we move forward and the pandemic hopefully eases over the next year, they'll probably retain that mix of both models, that hybrid model, face-to-face and digital. Because obviously that won't work for everybody, because not everybody has access to digital tools and not everybody benefits from that. So I think a mix is really good. So on reflection, and looking at the learning of the last probably 10 months during COVID, I think it's fair to say that we can see that, you know, as across the partnership in Baines and across BSW, that we can be agile and mobilise services quickly where there's an urgent need and where there's a bit of money to help that along the way. And we've also learned that people can benefit from different models of service delivery, and that in fact these provide flexibility and improve access and more choice for people. And I think that will be retained going forward. And I think the other thing we've learned through a lot of the work is that it's so important to involve and engage and hear the voice of people with lived experience, both young people and adults, and listen to their experiences and, you know, develop as we move forward and develop new services. We do it in a sort of co-collaborative production way with those people. And Lucy will probably talk a bit more about that as I pass across to her now to pick up on where we are with the more transformational work around community mental health services in Baines and across BSW. So, okay, Lucy, if I hand across to you.
Yeah, that's fine.
Thank you.
Yeah, so the community services framework is really kind of looking to the future now. So it's about transforming our model of community mental health services for adults and older adults aged 16 plus. And it is a transformational piece of work over 3 years being led by BSW CCG and is one of the NHSE requirements of the long-term plan. So it is an ambitious piece of work, but it is over 3 years and is about us ensuring real and lasting change for people. So I guess as Debbie was saying, the real test for us will be whether people using services and with experience of services can feel a difference. So co-production is really important in getting that right for us in Baines. And we have a Baines Mental Health System Partnership, which meets weekly on Mondays, which includes people with lived experience of services and also carer representatives. And we also have a sort of newly established Baines Mental Health Youth Forum with 16 to 25-year-olds, and we meet with them sort of routinely just to check in and see what their experience of services are. So the transformational piece of work is really a journey, and we'll be developing and changing the model as we find out what works during the first year with the sort of the test group of primary care networks. We are looking as BSWCCG at risks and mitigations, and absolutely accept it is fraught with challenge, what it is that's being proposed, some which we can foresee and some which we can't at the moment. So there is a whole governance framework around the transformation that helps us work through that as a system.
Right. Debbie, does that complete the presentation?
That's us. We were very snappy.
We're very succinct.
Yes, very good. Very good. Any questions? Any questions from the panel? I'm sure there are. Can somebody signal by hand, because the chat facility seems to be right? Liz, please.
Unmute, please.
I should know by now, shouldn't I? Thank you both, Deborah and Debbie, sorry, and Lucy, for your reports. Thank you. There are just a couple of things questions I wanted to ask. And Lucy, you very kindly said, well, what are the questions you want to ask? And these are the questions that you said you wanted answers to. So looking at these on page 157, the proposed model looks really good, but I would ask, is it deliverable? Is it too ambitious? And I think you did say the timescale was over the next 3 years. So that's, Vic, if I can just ask 2 more quick questions.
Yeah, you carry on.
I would also ask for the priority to be early intervention to avoid crisis and hospitalisation. And I know, Debbie, you've talked about these helplines and telephone lines, etc. But for actually access to CAMS and to mental health resources, it often seems that the thresholds for intervention are too high. So I want to know, are you going to tackle that? And the main risks, you asked what the main risks are. Would seem to be, I know you're getting some funding, but it seems to be insufficient resources alongside a rapid increase in demand, which you've talked about, which will add to the pressure at a time when a new model is being implemented. So you're getting this new model, but you're going to have a lot more pressures on the system. So just 3 questions, please. Thank you.
Okay, so sorry, Liz, your first question was about early intervention and thresholds, I think, really. And I think, as I said earlier, I think the Thrive model will help us have a much stronger focus on early intervention and prevent hospital admission. And I suppose what we're going to try and achieve through the delivery of Thrive and the delivery of the model that Lucy is going to be talking about is removing some of those thresholds so that services blend them all together, and individuals and young people will pass through them, hopefully, if we get it right, in a more seamless way than they do at the moment. Because I think you're right. I think the siloed way that services are delivered at the moment and the different thresholds and criteria you need to meet to get into each hampers that level of integration that we need. And so the model, the Thrive model, and I think the transformation work that Lucy's talking about will be drivers for that. But as I was saying, a lot of that's going to depend on how well we can integrate that locally. It's a bit like the orchestra, making sure the right bits of the services come into play at the right time for people, as their needs might escalate or decrease without having to go into higher, more statutory services than are required. So does that answer your question?
Okay. I think it is very much in the future. You know, this is what we hope is going to happen. And so yes, thank you.
Yeah, and some of it we're starting to do now, because we have got a BAMES mental health collaborative that Lucy chairs, that has been set up in response to the mental health review. And that's got all the right people around the table, organisations, partners, and people with lived experience to try and pull that together and make it work locally. So there's no reason why we can't start, well, we're not starting to implement that in the near future, of course. It is an awkward time because at the moment we're in lockdown and we have COVID and all that's delaying things a bit.
Okay then, Alison.
Okay, thank you.
Thank you. I've got a few questions. But I've got loads of questions, but I'll try not to ask them all because it will take all day. So I'll try and summarise a little bit. Firstly, just to set the scene, I read somewhere in the report that there's going to be additional funding of 10.3 million on top of a 16.5 million baseline. And I just wanted to check, is that correct? And if so, what's the timescale for that funding coming in? Because I mean, it sounds very welcome. And is that just for Baines?
Do you want me to answer
Lucy? Yes,
do you want me to answer that now? That's fine. So it's to do with the community services framework. And it's a non-competitive process we have to go through, and we have to unlock that funding amount, and that's for BSW, and it's a 16.5 million baseline allocation, and we're also seeking to unlock a 10.3 million transformation allocation on top of that for the whole of BSW.
So does that mean there's more than 27 million more money coming into BSW for mental health services if it can be unlocked? Okay, that sounds good. That's a good start. Fantastic.
And so then we'll be looking at workforce expansion and how we use that funding. And there are some directives within that, as you'd expect from NHSE, which will include supporting VCSE with some of that funding.
And what is the timescale for that?
So originally the proposals had to be in tomorrow to NHSE, and that's the deadline we've been working towards. And then in the last week, they offered extensions. So we're now working towards a deadline of the end of February to get the proposal in. I don't know when the funding would come in though, if we unlock that. I don't know what the timeframes are because everything has shifted over the last week now.
Okay. And then just looking at demand on the service, yes, I mean the Thrive model is great and really welcome. But given that given that for a long time there's been a huge demand on mental health services, and I think mental health services have struggled to manage that demand, and often they've managed it by making the bar to access services higher and higher, so it's actually very difficult to get support. COVID has obviously increased that, and I mean it's really worrying. 30% increase in referrals to secondary care, 130 people waiting on the waiting list for adults. How long are they waiting? And also the fact that I think I read somewhere that there are more and more people being admitted without previously being in contact with community services, which suggests that people are having to go into crisis in order to access services. So that's a very worrying backdrop. And the same for CAMS. Looking at the figures, it looks like demand for specialist CAMS has doubled since 14-15, but caseloads have only increased by 24%. So again, that suggests that the thresholds are getting higher and there will be an awful lot of unmet need. So that's your starting point. And it's going to be very difficult, I think, to change the service model and make it much more accessible unless you have quite an injection of resources into managing the backlogs and getting the services functioning in a reasonable way before you can really start to think about transforming them in a positive way. So that's another big question. I don't know if you want to address that one now. Or if
yes, shall I make a start? Then Neil and Lucy chip in if there's anything to add. I think the first thing to say is that during the pandemic, we have seen probably more of an increase in the level of need, the acuity of need, more than an increase in demand, although that has started to change more recently. So it's the level of need. And I think from the discussions and all the various meetings we've had and feedback from providers, I think it's because people were a bit reluctant to present whilst lockdown was happening or when all the social distancing. So there was a reluctance for people to sometimes approach, and there was a piece of work to try and encourage people to present earlier. There was a media campaign and a social media campaign to try and encourage people to present more earlier rather than leaving it to the last minute, because that was something that was being noted. And in Baines, we did have a particular issue with hospital admissions between April and November. And that was particularly where we had people with a sort of comorbidity of mental health and autism or ASD. a sort of dual diagnosis. And that happened, and I think that was probably a result of lockdown and people suddenly finding it hard, particularly people with autism, to adapt to the new normal and some of the issues around the stress in families. And that has, I think that was a blip. And there are special arrangements in place, Alison, I don't know whether you're aware, called Transforming Care, where people are admitted to hospital like that with ASD and mental health, or learning disability mental health, where we have to carry out care and treatment review as soon as after they're admitted, and look to how to move people out as quickly as we can. And that has happened, and most of those people are now out of hospital and back in the community, I'm pleased to say. So I think that was a bit of a blip. I'm hoping that won't continue going forward, and we're strengthening locally our arrangements for doing CTRs and the preventative work to prevent people's needs escalating to go into hospital. But you are right, I think there is I don't think the thresholds have increased, but at the moment, during lockdown with the acute needs because of COVID in the mental health services, some referrals are being diverted and reprioritised. But so I think the new money that Lucy was talking about and the Thrive model will try and focus much more resource at sort of what we call community resilience, supporting people to stay well and be well in the community, and using that funding to go more to community organisations and the third sector. So I think that will help, but I still think you're right, it's going to be a challenge as we come out of the pandemic to mobilise new services. But I think there is a huge commitment in Baines and across BSW, and a huge enthusiasm with providers and commissioners and people with lived experience to deliver these changes. So I think, you know, that is positive, but that doesn't underestimate the challenge of trying to achieve all of that. So it's a bit of a long-winded answer, but Lucy or Neil, have you got anything else to add?
I was just going to add that the new model is built on the understanding and agreement that it is about partnership across specialist services and local services, inclusive of a broad third sector, social care, housing, drug and alcohol, and many more, as well as those more specialist services. So it is about bringing everybody together in terms of kind of the widest determinants of mental health, and working really truly as a system and an integrated system, so that you get this kind of seamless, timely, early support for people.
Okay, so
I'm sorry. In terms of the way that we've worked as a system in supporting hospital inpatient flow and discharge arrangements, we've got the lowest numbers of delayed transfers that I've ever seen for Baines, including when I was at AWP for probably about 10 years. And I think the collaborative working around the step up and step down model at the Wellbeing House has made a huge difference. So we have inpatient flow meetings with AWP every week, and we're certainly of the 3 localities the best placed in terms of our system response in supporting discharge, and we're having the least difficulties. So that's working really well in supporting the system at a difficult time.
What about
Neil, you mentioned the Wellbeing House. I've had the opportunity to visit that on a number of occasions. It's an absolutely magnificent facility. It's worked so well. I met a young lady that was there. What struck me at the time is, and I said that speaking with the manager there, that young lady had been in mental health services since she was 5 years old. And that struck me. I didn't know, it was shocking to learn that. But and when I was visiting, it was a 5-day facility. I'm so glad now that you've made it into a 7-day facility, because that was the people using that facility. That was what they were screaming out for. Is that it was this interruption of a break for the weekend, and that you've actually eradicated that by making it 7-day facility. So that's excellent. Look, I've got Andy and Kevin on the list, but I'm going to bring in Mary now, just because she has something to contribute.
Thank you, Councillor Pritchard. I just wanted to say thanks to Lucy and Debbie. Colleagues in Children's Services have been advocating for a long time for increased investment for children and young people across Bath and North East Somerset. And it is really, really pleasing to hear the additional opportunities and the additional funds that are coming in across the locality. I'm really, really pleased at Breathing Space, which is a provision for 16+, because that is something that young people fed through in the consultation around the mental health review a couple of years ago about having a safe place to go within the community. So I really, really welcome that development. On behalf of Children's Services, Lucy has been working very closely with colleagues across education, with children's social care, our early help colleagues to look at strengthening that offer. So I'm really, really pleased. I do recognise what Debbie says in terms of the system working collaboratively, but equally we do know that in terms of the statistics for young people experiencing poor mental health, that the statistics are really high, and it is really incumbent that where we can, that we wrap those supports around as best we can to enable young people to thrive, but also for their emotional health and well-being not to deteriorate. The investment around supporting young people going back into school and to support parents has also been really, really welcomed. But I think there is always more. I've had sight recently of a paper that the Children's Commissioner had shared around the whole range of developments that have happened both in school and in the community. And I wonder if it would be useful to share that with colleagues, because I think there is a breadth of development that perhaps isn't always seen and that might be useful to share.
If it raises the profile of mental health, so be it. I'm going to call Andy now, please.
Thank you, Chair. Excuse me. Thank you, Debbie, Neil and Lucy for your report. And I have to say that having read it, and it was quite a long report, that it seems to me that your methodology is sound. My question is essentially about the link to secondary schools. On page 71, you mentioned that there are some secondary schools that have what you call a CAMS Thrive practitioner. And I was just wondering two things really, why those 12 secondary schools were chosen, and precisely what does that mean to have that individual, that Thrive practitioner, and how they will do their work within those 12 schools. And following on from that, further on in the report on page 122, it talks about the other secondary schools where it says that each secondary school will have a named worker. And I was just wondering again how they will actually go about their work and what sort of time they will have in the school and how the whole thing will operate. So I'm very enthusiastic about it. I have some reservations about how effective it will be based on resources, really, because I think the model is fine. Thank you.
Okay, shall I start off, Lucy, and you chip in if you've got anything further to add? There's 12 schools mentioned in the report, in the bit that you looked at. They were talking about Wiltshire schools. So in Baines, we have a CAMS Thrive practitioner, a named link for every secondary school. So that applies to every secondary school in Baines. I'm not quite sure, unless Lucy knows this, how much time and resource, but it's the same role as described in the Wiltshire bit of the report, that they provide training and support and strategies to support pupils to staff, but they also go in and provide interventions to groups of young people in school. But I'm not quite sure how much resource that translates into days of the week, and I don't know how much that model differs across BSW, to be honest. But in addition to that, of course, we have the community mental health support delivered by CAMS, that team lead and practitioners that support, I think it's about 20 schools in Baines that have been identified with their particular issues. That's primary and secondary schools. So that team will also provide additional support to schools where they're struggling with some pupils. So I think, yes, that linked named Thrive practitioner we have in Baines for every secondary school. And there is that additional team to provide more targeted support called the mental health, which is the mental health support team that just support those 20 schools that have been identified where there are particular needs. But what I can do, I don't know whether Lisa, you know how much resource they've got each week.
No, I don't know that detail, but I can find out, and I've got the list of the 20, so we can circulate that if that helps.
Yeah, so I can provide that further detail, Councillor Watt, if that's okay, at a later date.
Debbie, one of the problems is that we're principally concerned with Baines, but we are in the STP, and it straddles across into, you mentioned Wiltshire schools and that, and there is on page, let me see, 127, and it says all areas in BSW perform worse than the national average in the numbers of children and young people admitted to hospital for self-harm or mental health crisis. Baines is just above the average. Shorter lengths of stay and intensive treatment at home and in the community is usually associated with better outcomes. But what it is, and this is, I think members of the panel, it's complicated, the issue, because sometimes it's not us, it's the STP as a general, and then it reflects back into Baines, and it's very difficult to try and get the balance between the two.
Thank you, Chair. Yes, it is, and it is and that's one of the complications now, because the CAM service delivered by Oxford Health and the secondary mental health service is now commissioned across BSW and covers a wider footprint and managed as a system. So we are not managing those contracts at a local level like we used to. So we have got a bit of extra work to do now. And normally, I think if we hadn't had the pandemic, we would have probably been able to pull out more information that was just relevant to Baines. So I'll take that on board for any future reports to have a much stronger focus on Baines.
Very simplistic interpretation of this. We're not disadvantaged by being in the STP.
No, I don't think we are. Are
we advantaged?
I think there's lots of benefits in terms of working collaboratively. I can see Les laughing at me here. I think there's some challenges, definitely there's some challenges about how we make sure from a locality perspective, we influence very strongly what gets delivered, and we make sure that's tailored and fits well with our local services in Baines. But I think what we've seen through the pandemic is there are advantages that we can mobilise things across BSW, provide mutual aid, and that has happened a few times where we've got stuck in Baines or where there are another areas got stuck, we've helped each other out. And we can share expertise. But I think overall there are advantages, but I think with the challenge for us locally, as in terms of the ICA and in terms of commissioning and local providers, is just to make sure that the needs of our locality is reflected in BSW. And I think that's a challenge for us as commissioners.
Right, I'll bring in Les now a moment.
Thank you. I was just going to add that last bit, actually. I mean, obviously, it's really important that our locality has the right amount of say and resource in that. And I'm not sure if Corinne's still on the call or not, but she would be saying the same as me, that as the Chief Operating Officer and as the DAS in this area, then the team themselves do make sure that the locality gets their reasonable share and that our needs are being met. It's one of the highest agenda points actually for the team doing that when working across BSW as well. So to just give you that assurance, Vic. Okay, and because it is, this is on our pre-meeting, that it was a concern raised by panel members then. So, and as Corinne's here, can she give further endorsements of the situation?
Yeah, hi, Vic. So I think the team have outlined the position. I think, as you'll have probably read in the integrating care proposals and the consultation, there is a very strong flavour in that, and recommendations around place and locality being really, really important. And therefore, we are, as we move forward through our integrated care alliance arrangements, ensuring that the priorities for the locality are very clear, and therefore we can, we know how we're kind of responding to those. So I'd just like to reassure, the 3 localities across BSW, Swindon, Baines and Wiltshire are coterminous with their local authorities. And therefore it's really important that we, ensure we, as I said, identify those priorities and work on those together in the locality.
Thanks, Corinne. So we've got from the most senior representation across STP now is very reassuring. So I've got 2 more speakers now, Kevin and then Alison. So Kevin, please.
Many thanks, Chair. To start with, please, the first question I have is around on page 149, you've got outcomes mentioned as one of the priority things that you're going to be looking to work on. When will you have those outcome measures, so that will you be bringing that back to us fairly shortly, or have you already got those in place? And then on page 155, it looks like you've done a summary of the new model. And is that new model include prevention? And does that prevention also include community services within schools? And just to tie up the link there, I was my final question really, is that you mentioned the orchestra of mental health provision. Who actually is the conductor here? Because you've got an awful lot of things to bring together, and including when you talk about schools, there's this national initiative about sort of mental health trained first aiders and things, and without sort of joined up thinking, this can either be overwhelming in schools or it can detract from a good, complete joined up picture.
Okay, thank you. I'm just trying to find the relevant pages in the report because my system's just gone down, so I've just logged back on.
That's okay.
So while that's happening, just in terms of outcomes, we have developed locally mental health outcomes for Baines, which will cut across services that we commission as a council and local health services, and along with Virgin Care as well. So we're trying to join up as much as possible. I'm looking at Lucy's, I'm saying this because this is Lucy's piece of work. But so you might want to add in.
Me to add?
Yes, please.
So yeah, we have a mental health outcomes framework, which was one of the things that we said we would do through the Baines Mental Health Review. We've co-developed that with our Virgin Care commissioners. They're now in place across commissioned mental health services and the Virgin Care directly delivered and subcontracted services. The intention is that through the Mental Health Collaborative, we will start to use the outcomes framework across all wellbeing and mental health services as far as possible, because that enables us to look at how well we are working together as a system. Do you want me to go on to the next one, Debbie?
Yes, please.
Yeah. Okay, so I think you're asking about the community services framework model and whether it includes community services within schools. And that's quite tricky because it is 16 plus. So we are developing links with the University of Bath and Bath Spa and Bath College. And we are thinking about young people aged 16 to 25. And I guess that the services within schools bit probably fits more with the part of my portfolio that looks at children and young people's mental health. And the governance for that is really the Children and Young People's Emotional Health and Wellbeing subgroup, which is a subgroup of the Children and Young People's Plan. But I guess the strength of having an all-age portfolio is that our Baines Mental Health System Partnership, which is our Monday meeting, thinks about children, young people's and adults' mental health. So we're continually trying to look across all ages and whole system. so that the community services framework model itself won't necessarily focus strongly on schools and the kind of services through schools, but because my portfolio is all age, I'm constantly kind of looking across the whole lifespan, if that helps.
Yeah, it's obviously an area that I mean, I understood from one of the last answers that was given that obviously there's named practitioner for secondary schools,
yeah.
But as you're probably very aware, the mental health issues are going much more into primary, and there's been some acute issues in primary schools, and so obviously that's an area that if you're looking at prevention, which looking at your model at the end, and the question, is there anything missing? Maybe a thing under prevention or the prevention heading wasn't very obvious, if that's what I was trying to get at, really.
Okay, thank you. I have had that feedback before as I've been going out and talking about the community services framework model. So I have already fed it back to BSW CCG, but I will do so again.
Lucy, you say your responsibilities lie across the whole age spectrum. But what I find very alarming is it says here 50% of lifetime diagnosed cases of mental illness are established by the age of 14. It seems quite hopeless, doesn't it?
It is, yes, it is alarming, yes.
Yeah.
Yeah.
It's just just venting a frustration there, but obviously.
And that's, Chair, that's a national picture. That's not just locally, and that's a national picture. And that's why I think, going back to the point Mary made earlier, why it's really important to not only to work with children and young people at an early age and get the level of support and intervention right, but also to provide that early intervention to prevent those needs escalating and becoming a lifetime issue. And that's where I think we've got to try and focus. And Mary's right, we need a lot more resource going into that side of the service. And the whole part, one of the priorities for the long-term plan is to get equity between physical health and mental health. And there is the mental health investment standard funding, which comes into the CCG, which is about trying to provide additional investment and resource across both children and young people's and adults' mental health services, in addition to the funding that's coming in through the community services framework, to try and make sure we get those services right for children.
So it sounds a hopeless statement, but it's not without resolution.
It's possible. I think we've got a challenge, and it's a national issue. But we do a lot of really good stuff in Baines, particularly in children's services, and there's a lot of really good things happening in schools. When I used to work in children's services, we've got a lot of support teams working with schools, which is really unusual when we compare us to other local authorities. So I think if anybody stands a good chance of starting to get this right, I think we do in Baines.
Excellent. That's what I like to hear. Mary.
Thank you, Kevin. Thank you, Councillor Pritchard. I'm just reflecting back for colleagues that when the Thrive model was developed a number of years ago in Bath and North East Somerset, there was a lot of work done with schools at the time, and there was a lot of engagement both with primary and secondary. I'm just wondering, perhaps, Lucy, if it would be possible for that to be revisited, because that is a number of years ago. And we do know in terms of the presentation of needs for our children and young people, and Kevin is absolutely correct in terms of what's being presented in our primary schools, where there would be an opportune time to revisit that and look at what else we might need to develop, particularly as we're in the third lockdown. Thank you.
Alison.
Thanks. Yes, I absolutely agree that early intervention is crucial if we want to change long-term outcomes and change the progression of mental health needs for individuals. And that's why I don't feel I really had an answer to my question about what we're doing to address the immediate problem we've got of waiting times, both for adult mental health services and for CAM services. And, is there a plan to try to bring those waiting times down so that people do get access to care in a much more timely way than they are currently?
Thank you. Alison, in terms of the plan for the performance of AWP and Oxford Health, that's an issue I'll need to take back to BSW colleagues, because the contracts are managed and performance managed at that level now rather than that locality. So I'm more than happy to say that's been raised and discussed here, and to take that back and to feed back to you what the plans are. And I suppose the issue is when you look at those slides, I think part of the feedback was, well, we perform better than the national mean or average. But I think that doesn't hide the fact that our figures, our waiting times have got worse. So I do think I'm more than happy to formally take that back to commissioning colleagues at BSW and ask them to what the plan might be to address those performance issues. Thank you.
Thank you, Debbie. That would be good.
I think
Kevin.
Neil wants to add something as well. I can see he's waving his hand.
Sorry, Neil. Neil, please.
Thank you, Councillor Pritchard. I'm just going to add that Debbie's right. The contracts are led and performance managed at BSW level, but that doesn't mean that locally we're not working with AWP and with partners proactively on what can be done before it's addressed contractually. So, for example, we've been in discussions around how we can risk assess the people on the waiting list, encouraging processes to be developed to give us assurance around people's safety while they're waiting to be seen, and also looking at what third sector partners might be able to offer once those people have been sort of stratified by risk, and seeing where that might be appropriate. So it's being addressed through our local partnership arrangements. This is exactly the sort of circumstance where we can come together and help each other out. So it's not all bad news, and we are working on it.
Thanks, Neil. Excellent. Final speaker, Kevin.
I think actually, Chair, that very kindly, Mary, sort of her last comment came in as I was after I'd pressed my MIS, but basically to try and get something to looked at and reviewed and come back with that early intervention and what's been happening along there would be great. Thank you.
Right, thank you. So thank you all, Debbie, Lucy and Neil, for your contributions. Mental health has been the poor relation for so long. It was starting to get on track, and then it's had this dreadful interruption of the COVID, which is only going to exacerbate the problem. But I'd thank you all for your contributions, and thank the officers again. It's a lengthy, complex paper, and it's instigated a lot of questions. But thank you all. So I'm going to move us on to.
Thank you. Bye-bye.
Bye then. Bye. I'm going to move on to item 11 then, violence reduction units. And if I can ask Sally Churchyard to present the report to the panel, please. Sally.
Hello. I think the convener of the meeting might be able to start my video. It went. Thank you very much. Thank you. Okay. So, Chair, panel, thank you very much for an opportunity to bring a paper to PDS this morning and to present something on the work of the Violence Reduction Unit. This is very much a partnership initiative under the Community Safety and Safeguarding Partnership, and has a clear ambition that children, young people,
Hello there, you're right.
across Bath and North East Somerset should be able to lead lives free from serious violence, both in their homes and in their community. It is also a wider partnership with the Office for the Police and Crime Commissioner, the Police and Crime Commissioner. And that office has drawn down Home Office funding, which we benefit from. And in this, we also work closely with the 4 other local authorities in Avon and Somerset, providing an opportunity to share ideas and resources and initiatives. My report sets out the broader context for this piece of work, which all stems from the National Serious Violence Strategy published in April 2018. And it highlights a couple of distinct features of this work locally. One is that following a stakeholder consultation, the Police and Crime Commissioner has broadened the local definition of serious violence. So in addition to what we might term street violence, which the national strategy set out to address, including serious violence against the person, knife crime, robbery, drug dealing and homicide, we have also included serious domestic abuse and some serious sexual abuse, because in Avon and Somerset they were felt to be more significant perhaps than across the piece nationally. So we have adopted that wider definition within Bath and North East Somerset. And secondly, again at an Avon and Somerset level, the Police and Crime Commissioner has introduced what they term a hub and spoke model, where they draw down the funding and distribute it proportionally between the 5 local authorities. This benefits Bath and North East Somerset because we do receive approximately £114,000 a year based on the level of reported serious violence and the population. And I think it's fair to say that Bath and North East Somerset, which enjoys a relatively low level of serious violence, would never have been eligible to receive direct funding in this way if we were not part of this wider initiative. So that has been good, and it has been good for us to be able to work in that way. We've been able to, because of having a relatively low level, as identified within the problem profile, which we commissioned from Crest last year, we have been able to take very much a preventative approach, looking at universal and some targeted prevention work with young people. And that has placed us in a good position to take on the requirements of a new serious violence duty, which is to be introduced in April. I'm afraid I'm not able to share very much with the panel about the detail of that because it hasn't been published yet. But we are ahead of the game. Only 18 police force areas have received this funding, so we are amongst those to have benefited from that. In compiling the problem profile and the work we're doing in response to that, we have very much listened to what children have been telling us. And in the focus groups that were held earlier in the year, 60% of young people told us they believe serious violence is an issue in Bath and North East Somerset. And at an event I attended with the Youth Forum and another with DHI, I heard young people saying very clearly that they believed knife crime was underreported, and that was for a variety of reasons to do with uncertainty about the process and fear of recrimination should they report. And so we very much tried to apply what young people have said in the work we've done and make sure that we're feeding back to them and taking them with us on this journey. So we have had funding for the last 2 years. They have been short years in different ways. The first year really began September, October time when the funding was confirmed. And this most recent year, of course, has been characterised by the challenges of working during a pandemic. Nevertheless, we have achieved what we've been asked to do. We published the problem profile, which was attached to the paper. Well, there was a link attaching it to the paper, if anyone wants to take a look at that. We are in the process of refreshing it, though, and we're wanting to take a closer look at under 25s, which was the national request. And it has been challenging to get information for that particular age group because of the way services are designed. And we're also very keen to look at the impact of the pandemic on the nature of offending and on people's access to support and to services to address that. The response plan is owned by a serious violence steering group that reports into our exploitation subgroup, which is part of the Community Safety and Safeguarding partnership. And that gives an opportunity for a very wide partnership to contribute into that plan, to take away actions from it, and to have some oversight of the progress we're making there. The work done is on a number of levels. One is we have the ability, or have the ability for 2 years, to commission direct services to test out and strengthen an emerging pathway that we're developing, including a universal offer to schools, beginning with those in hotspot areas, to ensure that all children have the opportunity to learn about the dangers of carrying knives, to learn about the way in which people groom young people and how they might be able to take steps to keep themselves safe and when to talk to trusted adults. And then we follow that with a detached youth work offer, which is happening across the authority, led by DHI with other services involved. And to date, they've made contact with over 300 young people who are out in the evenings gathering, and they've been able to speak to them. They've been able to offer them advice about keeping themselves safe during a pandemic, but also understand some of what's going on for them, and in some instances signpost them into services. And that's been very beneficial. Then there is more focused work for those who have current issues. So there is some work with under 25s who are impacted by domestic abuse. There's been work with parents to look at how they can strengthen parenting techniques and skills with children who might be violent in the home or in the community. There's been some work with street doctors who provide a first aid approach for children who are actually getting involved in risky behaviours. And in some areas that has been shown to save lives. We are working as well to divert young people from a formal criminal justice outcome wherever we can. And we're working closely with police on this, so that young people in schools, who are carrying low-level weapons or knives, may be able to be diverted into a police-led or partner-led workshop to look at that, rather than necessarily being straight away charged to court. We've also been able to develop some of our processes, and in particular, we work closely with police who use a serious violence app to identify people under the age of 25 who are at high risk from serious violence, and that might be at risk of perpetrating it or being harmed by it. And it may not be a surprise to the panel to learn that in many instances, particularly with young people, they fall into both camps. They are vulnerable from injury as well as at risk of hurting their peers. We look at young people who are known to be a high risk. We're looking at those who are coming on the scene, perhaps as an emerging risk. And we look at those where the risk seems to be escalating quite quickly in recent weeks. And a multi-agency partnership can take a view of that. We look for assurance from agencies working with those young people that what they're doing is taking full account of the risk of serious violence. And we put in place routes in, assessments or routes into other services where we're not able to get that assurance. We are also looking at a complex strategy, and we're able to pilot a new process in Baines to look at how we respond as a partnership to a group of young people whose behaviour is impacting on themselves, on their peers, their siblings, their community. So rather than picking them out individually, we're looking at the interactions between them, we're looking at how they influence each other and what we may be able to do to support them individually, as well as to challenge their behaviour as a group. So those are some of the examples of things that we've been doing. It has been challenging working under a pandemic. Initially, we saw young people, as all of us, perhaps very frightened and spending a lot of time back indoors. By April, though, they were coming back out into the community, April, May, and we've seen groups of young people gather. So our most promising practice has been able to be the detached youth work, because the agencies involved have been able to continue to make that direct contact with young people throughout. The statutory services, including the Youth Offending Service, have continued to work with those at highest risk. But there will be some young people that we've not been able to adequately reach, and panel will have heard before about the issues faced by children who don't have adequate IT provision within their homes and can't avail themselves of education or of other kinds of interventions. So we've been taking a look at how we might support young people and families with hardware and software to improve those communications. The ability to address that digital poverty and sometimes other kinds of food poverty, and the support that a range of agencies have made available for young people through the pandemic, has seen a development in trust and creative ways to work. And I think our previous item highlighted that going forward, we hope that we will be able to take some of those new ways of working with us into the future. So right now we are embarking on this refresh of our problem profile in anticipation of being able to benefit from a third year's funding. This still has not been confirmed. And so the work we're doing is against that possibility rather than a certainty. But if we do achieve that funding, we now intend to appoint a coordinator to take the work forward and bring more resource. Even if we don't have further funding, we have learned through this, and some of those new systems and processes will go forward, and certainly the targeting and tracking of individuals will be here to stay. I think that's probably all I want to say in terms of introducing the report. I'm very happy to take questions. Thank you.
Sorry, I beg your pardon, I'm on mute and I'm wondering why Paul won't answer.
Is it Vic?
Yes, Paul, please.
Sally, it's lovely to see you again, even as it's virtual. I think the significance of this report is by investing in this particular topic, it hopefully means that you catch youngsters before they become offenders, and I think that's really great. The message that came over to me, and it's probably a question for Mary as well as you, is that the issue in my mind is the reason we are, I don't know whether successful is the right word, but better than other areas, is we've actually got a really heightened voluntary sector that we work with in partnership. And I think the committee would actually gain quite a bit. We hear a lot about 3SG, which is mainly an adult focus, but I feel that our working with the voluntary sector is really important. And I very much would value having at some stage in the future, if Vic or the committee actually agree, looking about how we interact with the voluntary sector on issues like this. And in particular, it's nice to see Youth Connect being mentioned there. And at some stage, that was a big decision to let them free. And it would be nice to have some feedback about how Youth Connect is operating now it's in the marketplace. So sorry if that's a bit of a wide-ranging question, Vic.
Do you want me to respond and then perhaps Mary follow on if she would like to?
Yeah.
I think you're right. We have fantastic voluntary sector colleagues and agencies, and we benefit hugely from their involvement in this work, as in a variety of other pieces of work. Youth Connect Southwest are doing well, and happy to make some separate feedback available or work with Tracy Pike, the Chief Executive Officer, to share that. But it is a good news story. In terms of serious violence, they are helping with the detached youth work with DHI. They're also running a street to studio music project for young people involved in serious violence. So very positive contribution that they're making. I think, you touch on a really interesting question of why serious violence isn't more of an issue here. I think the voluntary sector is a big part of the reason. But our problem profile is quite interesting, and it flags that we do have a number of children experiencing adverse childhood experience. We know that domestic abuse, which is one of the key drivers for serious violence, is a real concern in this area. We know that we have a disproportionately high demand for drugs in this area compared to our population. And there are concerns around school exclusions. So there are a number of drivers that in other authorities do play out in serious violence. And this is one of the things that we've asked Crest to take a look at with us, to try and get a better handle on what protective factors are operating in this area in order that we can highlight them and maximise benefit. And certainly the voluntary sector is one of those protective factors. Mary, you want to say more?
Sally, could I just, before Mary comes in, the link for the profile, I couldn't open that. Could you send that as a separate email?
Yes, I can make that available with the notes of the meeting. Apologies for that.
That's probably me.
That would go to all members, wouldn't it, Sally?
I think it should do, just in
Yes,
case that's affecting other people, yeah.
Thank you.
Yes, if I may, thank you, Councillor May, for that question around the voluntary sector. To reiterate what Sally has said, we benefit hugely from a really strong voluntary sector across Bath and North East Somerset, both all of those organisations that work with young people up to 18, but increasingly some of those who work up to 25. And I think what we heard earlier in the piece around mental health was the expansion of the range of services that some of those voluntary sectors have also taken on over the last number of years, thinking about some of the counselling and the support to young people. But critically, I do believe what we also have in Baines is tremendous commitment from all of our partner agencies around prioritising whatever the new and emerging risks and concerns are for our young people. And I think Sally has detailed really well in this report the work that was done around the problem profile last year, but also the challenges that our young people have had in the last 12 months and the more further work that we do need to do. I think we all welcome the new duty that is coming in April around serious violence. And I do think it would be really helpful, perhaps, as part of our agenda setting to put another agenda, a briefing in around that in a couple of months' time. But certainly would be very happy to speak and arrange for a particular focus on the contribution of the third and community groups to delivery of services for children and young people at a future meeting. I would really welcome that. Thank you.
Thanks. Liz. Sorry, Michelle.
Thank you, Vic, and thank you, Sally, for the report. And it's clear some very good work's being done locally with vulnerable young people. I just wanted to ask a little bit about the county lines, because I noticed it was referenced in the report. How successful breaking them up has been recently, and I'm aware that there are some county lines operating locally. And also, are we really confident that we know who those young people are who are at risk of becoming involved? And also what work is being done with them? Thank you.
Okay, thank you. Yes, the pattern with county lines appears to be that a while ago, perhaps just pre-pandemic, we were understanding that they were no longer seeking to recruit our own young people and were bringing outside young people in.
Sorry, again, sorry.
Very sensitive. Apologies. Did you hear any of that?
Could you just repeat it, please, Sally?
Yes. Okay. Apologies. So prior to the pandemic, our understanding was that county lines were no longer recruiting local young people into drug dealing. More recently, during the pandemic, we think that practice has returned. And certainly some of the young people that are known to the Youth Offending Service, which I manage, are being almost certainly being criminally exploited in that way. The work to address that is firmly within the exploitation subgroup of the Community Safety and Safeguarding Partnership. That's where it's led, and the serious violence work contributes into that, and in some ways is broader than that as well, because not all the young people we're working with are involved with county lines. There are other drivers and other reasons for their behaviour. Within our children's service, we have the Adolescent and Care Experience team set up with a specific remit about around children who are within the social care threshold and experience exploitation. And that is wide. That includes child sexual exploitation as well as criminal exploitation. But those young people have an allocated social worker and a plan, and a range of different interventions involving partner agencies, again, including the voluntary sector. Those that are in the youth offending service equally have a named worker who leads a plan of activity to address that concern. It's complex work, it's difficult work. Young people don't always trust us to say what's going on. And we do see young people being harmed. It is quite distressing. The complex strategy that I referred to just now is a really significantly different piece of work, where we're looking at how the partnership might come together around not just young people, but also the areas which they frequent, and looking at how we can have an impact on that whole system. And that will include, again, working with our voluntary sector colleagues to do that, and also closely with police and with those in the antisocial behaviour team. So it's very much a partnership approach. No one agency can do this.
Sally. Liz.
Thank you, Sally. Comprehensive report as always, and I just reiterate what everybody said about what you're doing to tackle and reducing reoffending and offending. I just got two questions, if that's okay. I was really interested to hear how you identified Year 7 pupils and schools for knife awareness workshops, and Year 6 pupils for Stand Against Violence. But I see that you've said that within schools that are willing to host workshops, the offer is universal to all Year 7 pupils and all Year 6 pupils. Sally, are schools aware of this? Because I think there may be youngsters that we are missing, and it might be good for them to know about this.
Yes, thank you. We've commissioned DHI to deliver to Year 7 pupils, and Stand Against Violence, another voluntary sector service, to deliver to Year 6. And they have been engaging with schools, and they have set up some workshops already. There is a concern about how quickly they'll be able to be delivered because of the pandemic. At the moment, schools are not in a position to receive people delivering workshops on site. Some are willing to look online delivery, but some of that delivery may need to wait a couple of months. The intention, as part of that pathway I was talking about, would be that there would be a universal level of information awareness raising for all young people. The police have appointed 2 dedicated PCSOs who link with the schools and undertake some of this work themselves. And the police are also developing programs. Our intention really is to arrive at a BAMES approach to doing this, to ensure that that is there, maybe as part of the PHSE programme, and supplemented by others coming in. For this year, we have focused on the hotspot areas that were identified in the problem profile, on the very broad, perhaps rather crude basis that those children may be amongst those at greatest risk. But the intention would be to offer that out more widely. We do have schools and college representatives on the serious violence steering group, so we do have those links with schools. But I guess there's always more we can do to get the word out.
And that's excellent, indeed. And the last thing, and it may not be under your remit, but in paragraph 4.2, I'm just wondering, have we enough safe accommodation to support those harmed and their children, those who are suffering from domestic abuse?
Yes, and I included this into the report because there will be a new duty as well for local authorities around provision of safe accommodation. And it is directly relevant to our work because of that broadened definition of serious violence that we're using. The government is making national funding available, £50,000 per local authority, to do some preliminary preparatory work. and that will be used locally to build on the findings of our problem profile, to give the most up-to-date analysis that we can of the level of need, and then to look at the provision. It's likely that provision won't be there for everyone who's needed, but I don't know that, and we won't know that until we've completed that piece of work. It is significant though, because my understanding is that there is no new national funding coming for that, so that will be a pressure and a challenge for local authorities and partner agencies as well.
On that subject, Sally, will there be a duty to cooperate with our neighbouring authorities? Will we have to accept some housing provision for youngsters across the border, and can we actually go into other authorities to identify it? Because it's going to be quite a challenge, isn't it?
It will be a challenge, and the Domestic Abuse Partnership is overseeing this piece of work, and a task and finish group has been identified. I will pass that question into the task and finish group to consider as part of their work. But no, that the duty, I don't believe, will extend to that. And neither will it extend to a whole range of other supports that ideally we would want to see, including work with perpetrators or people at risk of perpetrating domestic abuse. There is provision, but it isn't sufficient for the level of need that we see.
Right. Councillor Kumar.
Thank you very much, sir. Chair. First of all, that I'm attending and substituting my colleague Jessica, so I'm not a permanent member of this panel. Number two, disclaimer that my wife also works for the Children's Services, so just that a disclaimer. Now, two specific questions, and as I said, I'm not a permanent member of this panel, so I might not know whether this is an appropriate place to ask the question. First question is, as the council's advocate member for BAME issues, I have received some complaints about some of the institutional racism in our schools, both in independent sector schools and the state school, which has affected mental health of some of the kids. Now, what step can we take to root out this problem? This is a huge problem, an underlying problem. It's not open, but there is. And if we just close our eyes and say, oh no, in the best tradition of British culturalism, we should not talk about it, I think that will be not right. So what step can we do? And I'm talking, and I have some proofs, both for the state and private institutes. With a somber note, my second question is, which may bring some joy to all of us, that I have also seen a very high achieving pool of young people in our area. They're absolutely brilliant. Some of our kids in Bath and North East Somerset represent the country in chess tournaments, and some of the, including my own, let's see. And some of the kids also represent the region in national mathematics tournaments. Some represents in mathematics Olympiad. Now, I know that the Children's Services and Young People Services, we are trying to root out the problems, but how do we support for these high achiever potential young people? Can we support and do something for them? Thank you very much.
Okay, thank you. I can probably make a few comments. I can't fully answer your questions because I think they're broader than the work of the Violence Reduction Unit, but I do recognise what you're saying, and we hear that from young people we work with, that their experience in schools and other settings doesn't always meet the standards that we would expect for all children. And we do work with young people who've been very damaged by what's happened in their pasts, in a variety of settings where they have been. At the sharp end, and this is for young people who are perpetrators, as well as those who are hurt by this, we are involved in a piece of work with the local criminal justice board, following the report that David Lammy MP published in 2017, looking at disproportionality in the justice system. So locally, we are contributing into that piece of work across Avon and Somerset. There'll be a draft report in March and a final report later in the year, and it will make recommendations for all agencies. And as well as looking at the operation of the justice system and who is employed, and as well as looking at the support and outcomes for those who are caught up within the justice system, it is focusing on the drivers. One of those is around school exclusions. So that's the link I'm making. And I think it's a report that certainly we will benefit from locally. The Youth Offending Service Management Board will be reviewing that report. It may be that it needs to go more widely within the authority, and that's a matter here. Again, I don't know if Mary wants to add. She's indicating. Thank you, Mary.
If I may, Councillor Pritchard, if I could ask Chris to speak about some of the work that's happening within schools around exclusions, but also some work that's following the Bantering conference that we had a year ago. Chris, would you like to pick up on some of that work to address some of those concerns that Councillor Kumar has flagged up? Thank you.
Yeah, there's a number of pieces of work which are happening around, particularly around race in schools. Really, one is around supporting children that they can feel that they're safe and able to speak out and be heard about the issues that they're facing. So that's a piece of work that some of our commissioning colleagues have been working with our schools on, and we did a big piece of work on the bullying or banter, and there's some follow-up work on that just to make sure that our race equality incident reporting tool is right, and that schools and children can use it effectively. So that's underway. And we've also just recently started a race equality task force in schools, which is supported by SARI in Bristol and Black Families Education Support Group locally here in Baines. It's only just going up and going, but it's tended by schools. So there's a couple of secondary heads and a primary head on there. And the plan is, once we've put together the plan for that group, that we'll be taking that through to our school standards board and feeding back some of the recommendations we've got through that. And we've had reports on race and bullying incidents gone to our school standards board recently, back in September. I can provide more information about that. I'm just conscious of time, but just thinking about the other question, which is about making sure we're supporting our capable and bright and high achieving students. Every school should have a strategy about how they do that. So it's very much down to the school, so that they should be able to promote that group of young people. I'm not aware of anything we do collectively across as a wider council, but it certainly could begin some thought.
Thank you, Chris. Alison.
I don't know what's happened, but Alison seems to have disappeared from the meeting. I'll contact her and find out what's happened.
Then, so Kevin, in the meantime.
Thank you, Chair. Just a quick couple of questions, really, Sally, bless you. The first is possibly more a comment, but you were talking about getting or accessing younger people's views, and just wondered if you'd already done it or it's tied in with the SHOE survey, which I believe the St John's Foundation are now going to fund for the next few years. But obviously some of the questions around personal safety and how safe children feel and that sort of thing, maybe that's another avenue that might come up or not. And the other quick question was just around, I went a little while ago to Keynsham to listen, and possibly to yourself, was it, about the youth at risk strategy and how this may fit in with that, please?
Yes, I mean, it very much fits in with the youth at risk strategy. I think that was an example of where Baines was a little bit ahead of the game, because by the time we were being asked to be involved in the violence reduction unit, we'd already done quite a significant piece of work to look at how we work with our more vulnerable young people. And you might remember that strategy has 6 strands or 6 protocols that sit under it. One of them is around serious violence, and some of that work is being taken forward now through the violence reduction unit. And other strands are fitting with the exploitation group around missing children, sexual exploitation, criminal exploitation, etc. These agendas are very similar. Children obviously don't fall into neat camps, and many of them are affected by more than one of these really rather serious concerns. The comment about the SHU survey is that we've appointed Crest Advisory to undertake this piece of work. They do look at all the available research that's in the public domain and things that we're able to share with them more locally. I can look into whether going forward we can add any more specific question into that SHU survey, but there's a bit of a lead in for that. So I'm not sure whether that will be possible, but certainly information that's already available is fed into the wider analysis. Thank you.
Thank you. Alison, I think we've got you back again, so I'm glad you haven't left.
Sorry, my connection went.
No, and it was just that it was almost on 1 o'clock when we were scheduled to complete this meeting.
Yeah.
I thought we might have lost you, but anyway, welcome back.
I'm back. I think my questions may have been answered. The one was about county lines, which Michelle has asked, and the other one was about exclusions and the correlation between school exclusions and vulnerability to violence. And I think that may have been covered in what I missed. So if it was, I shall get the information from the minutes rather than prolonging things and making you go over old ground. If you didn't, then please, I'd welcome some input on that.
Okay, thank you, Sally. Sorry, Alison. Thank you, Alison. Sally. Yeah, we are fortunate that we do have low levels of serious violence, but any level of violence, it's 100% to the individual. So what we can do to eradicate it, so much the better. And it's I think there's certainly an appreciation of the work that's been done. So we have 2 recommendations to note. I take it that the panel would be acceptable in accepting those as they're presented in the essence of saving time. Okay, so I'm going to move us on. Thank you very much, Sally. Thank you for you and your team.
Thank you,
I'm going
everyone.
to move on now to item 12, and it's the corporate and budget planning for 21-22. And if I can invite Mandy Bishop to present to the panel. Mandy?
Yes. Thank you, Councillor Pritchard.
Mandy, can I ask, are you able to display on the screen that your presentation?
Yes, of course I can. I'll just check with you all. Could you just confirm that you can see it?
Yes.
Lovely, thank you. Thank you, Councillor Pritchard. For those of you that haven't met me, I'm Mandy Bishop. I'm the Council's Chief Operating Officer, fairly new into post, was appointed in mid-November last year, though I have been with the authority in another role for the last 2 and a bit years as well. So thank you for the opportunity to the panel to sort of present an overview of the Council's budget planning processes to date for 2021-22. You are the first panel we've spoken to, so you are a bit of our guinea pigs today, so please feedback the bits that are helpful, but others that you think may be helpful to the other scrutiny panels. And just a reminder that obviously full Council has a debate on budget in February each year. I'm going to do a quick introduction just to set a bit of context of the planning that we've undertaken to date, and then I'm going to ask Les and Mary and Chris to come in on the specific budget saving areas, because I'm sure that's the bits that you'll want to have a bit more of a discussion about. Bruce sends his apologies, so I will actually cover some of the public health savings and answer Councillor May's question that he raised earlier as well. We're also joined by a couple of other colleagues, Tammy and Liz, who are group accountants as well, so they're here to answer any sort of specific questions. So if I just move on to the context elements as well. So if you bear with me, this is in a PDF, so it just take a little bit of time to scroll through. So the headline around the budget challenge for this year, for 21-22, is, as you can see, that there is a growth requirement of just over £19 million. And many of you will be familiar with the reasons for that, which are detailed on one of the following slide, but they effectively relate to, we've got quite a reliance on income from 3 key income streams. We've talked about this today, the pressures on adults, children's services, and also a rebasing of budgets around contract inflations as well. The net results, once we factor in grants and growth around obviously local council tax, is that we've got an 8.33 million saving to make in 21-22. We've also factored in, because we have had to use some of our reserves this year, about putting some money back into those reserves as well to make sure we've got robust reserve levels in place. And it's worth noting that obviously we have got that minimum requirement that we will need to pay back over the years for the reserves we've used to date. And everything we're going to present today is sort of based on an assumption that we will have a 4.99% council tax increase next year. And obviously, if that's a decision that's not made by council, we would have to revisit that. So this table, which you will have had with the email that went out yesterday, just provides you as a summary of that. But as I said, the key message for next financial year is 8.33. But you can see this is very much a challenging 4-year sort of programme of budget considerations, and 22-23, the savings requirement is even higher. So we will be very much treating 21-22 like a transition year. Like I said, I won't sort of labour on the budget pressure element, because I know you will have heard about that, and there's been a lot of debate in sort of public forum and what our existing pressures are on budget. So as an approach, the plan very much in 2021 has been to stabilise our budget position and obviously start the removal from our reliance on our commercial income streams. But also there's been a huge amount of in-year work that's been put in place by people like Mary, Chris, Bruce and Les to actually put some in-year mitigations and on savings in place as well. So there's been quite a lot of work in year that those directors across the board, the council, have been putting in place to try and help the council's financial position. As I said, we're seeing very much 21-22 being a transition year to reset what the council's you know, I hate using this word, but operating model, what the organisation is going to look like moving forward, and how we can obviously deliver that in the most efficient ways as well. And some of that does include council structure. And I know there was a question raised earlier about director roles and portfolios, and we did start a consultation last week with the directors on the proposed changes to structures as well. And we will be going out if there are any vacancies at the end of that process. We will be looking at how we fill those as well. We've been doing in the background quite a lot of piece of work on IT and smarter working models, and we've heard a lot about the innovation today around how perhaps COVID has helped us innovate and move on, and whether we can use both in our outward facing services but in respect to the organisation as well, how we can capture that good practice and move forward. And the reality is, you know, we are going to have a lower income base moving forward. I'll let you read the bit about long-term strategies at your leisure. But the areas of priority and focus are very much those outlined in the corporate strategy that we recently published. And they're around about corporately, it's about investment in transport, but relevant to this obviously panel is about supporting our most vulnerable. We had a bit of a discussion with the RUH today about climate and ecological emergency and how we can work with partners to sort of move that agenda forward. There's a lot of work going on through our renewal about the local economy and how we're going to support the local economy to recover post-pandemic, and the Preparing for the Future programme, of which there will be a paper going to Cabinet in February, is about all our internal transformation programme, which I'll invite members to read that at their leisure when that comes out over the next week or so. The next slide just gives you an idea of the portfolio of savings. Adult services does include public health as well, just for your information. But as you can see, the planned savings in the area quite significant in this area and in children's services as well. And in part that is a reflection, as we know, of this significant percentage that those two service groupings are of the overall council revenue budget each year, which actually is quite significant. That said, I mean, we've heard a lot about, and it's great to hear the panel's sort of support for the directors and the services here today. We've continued to deliver a COVID response and changed the way we have dealt with things across the council over the last few years, but it's been particularly noticeable in the areas of public health, education, children's services and adult social care services as well. And as I said, the managers present today have worked very hard to deliver in-year savings to support the council's overall position, while addressing those demands around individuals who've got increasingly complex needs and mental health support requirements that we've heard a lot about in the previous reports. Our risk management processes, both around individuals, the services, the welfare of our own staff, is ongoing. I just wanted to highlight this because please don't underestimate the amount of work that is ongoing that we are having to do on a daily basis. So there's a lot of challenges, but we are liaising closely and there's support across the organisation. So there's quite a lot of resource movement across the organisation that we have undertaken in the last year as well to support key areas of work where we think there's particular risk as well. And we've heard about the excellent partnership work as well that is ongoing with our external partners in our communities. So at that point, Councillor Pritchard, I'm going to ask Les to come in just to talk through the adult social care growth that is proposals that are in the budget, and just to go through in a bit more details of the savings. I would also say you have had, as part of your pack, a little bit more detail on these savings, which we've actually put into categories just for ease of presentation, but obviously we're all here to sort of answer any questions that you may have. So if I could hand over to Les at that point, Councillor Pritchard.
Okay.
Thank you very much, Mandy. So just to go through some of this with you, the pay inflation relates to council staff that are below the minimum pay rate where we would like to see, and that's to ensure that they've got the right pay awarded to them. So that's the amount that we anticipate we need to spend on that. The demography is around some benchmarking and around some forecasting that we've been doing, particularly around older people's services and mental health and learning disabilities, and that's the additional spend that we expect to see. Now, I need to caveat that with the fact that what we're not quite sure about, there's some risk attached to that in relation to COVID. So what we don't know yet is what the final impact of the COVID pressure will be. So there is some risk attached to that amount just there. The contractual inflation we've put in there in relation to the contracts that we've currently got and what needs to be awarded. However, we are in the middle of the uplifts conversation that we have with commissioners on an annual basis, and Councillor Pritchard, you'll be familiar with that we often come in the February time, don't we, saying this is the amount that we can allocate in terms of an uplift to providers, but this is setting out what we anticipate that might be, but that is at the moment as well not absolutely confirmed. So we are coming to you much earlier, as I don't remember doing this in terms of the panel before. We normally do part of this sharing at a slightly later stage, but I think it's helpful for you to see some of those growth pressures that we are anticipating getting, but there is a level of risk attached to some of them in terms of the
contractual inflation. Is that principally Virgin?
No, it isn't, because as you're aware, I think it's all of the contracts. I need to go back and check that, Vic. I don't want to give the incorrect answer on it.
Right.
But the Virgin contract is a flat cash contract, isn't it? So
that's what I thought. So
it's a flat cash contract. But the local authority has a number in adult services across public health and adults. We've got quite a significant number of contracts that are outside of the Virgin contract. So it will be related to them, but I will go back and exactly check on that Virgin question.
Yeah.
Is that okay?
Yes, sir. Yeah.
So do you want to move on to the next slide, Mandy?
Please. Oh, sorry.
So I think there's this slide. If you there's the total there. If you just scroll up slightly, Mandy, so I can just see the total figure at the bottom there. Yeah, that's perfect. So what we've done from an adult social care perspective is we have identified where we can achieve the savings for 21-22, and Mandy had those in the one of the earlier slides in this presentation. And these are the 4 key areas where we think we can identify and make the savings. So that includes changing some of the ways we contract and procure our specialist and complex services. So Debbie Forward and her team, the team that look at learning disabilities, mental health and physical and sensory impairments, those savings relate to that. And we can say that we can see that we are we benchmark high in terms of some of those costs. So that will help bring us down into more of a more in line with other benchmark areas. What we're seeing with the reablement is that we are in the middle of a reablement review, and we've made some changes to the reablement service, and that 603,000 we anticipate being demonstrated through cost avoidance of services. So people receiving support of the reablement team and not going on to need longer term packages that they might well have done without the help of the reablement service. In terms of the Learning Disability Commission, that 19,000 has already been achieved for a saving for next year, because that was part of an advocacy recommission, and that has already taken place. And then the final, the just under 2 million, is about efficiencies that we think we can make through reviewing existing packages. Now, that I need to be really clear that we will still ensure that all of the people that have care and support needs who are eligible for social care services receive the service that they are eligible for. But this is making sure that we can ensure that any efficiencies that we can find are made. So
yes,
again,
before you carry on, I've got a question pending from Paul May. Paul, is that question relative to the slide as it displays itself?
Yes, please. If I could.
So if we get that continuity, so we don't have to go backwards and forwards. Okay, and Paul.
Yeah, thank you. I just wanted to ask the question about the 3% that Mandy put in as the funding for adult services. Can I check, with a £3 million cut, is the 3% ring fence to adult services, and why is the cut so large?
So, Paul, it all comes in, I think, as one pot, I think, in answer to your question, is my understanding. Liz might be able to correct me if I'm wrong, but all of that will come in. The ability to actually raise that as a figure will come in through the council's normal structures. But as you can see, there is an element of growth, so it will go towards the growth element. I think the growth element was more or less slightly less than that, wasn't it? The net position. Yeah. Will be, I'm just trying to have a little look, see if I can find the figures. Apologies, just give me.
Let's just flag it.
It will come in basically through the council's pot, and actually 2 million of that will go out against the growth budget. The remainder of it will also to be able to deal with any other sort of growth items that we have as part of that service. Liz, did you want to add anything else to that?
The shortfall, if you like, because based on this, it looks like the budgets are reducing. We've got headroom in the Improve Better Care Fund that will come in as mitigation for that. It's been, as you're all aware, it's been a very unusual year in terms of spend and budgets. So we're not sure what next year would look like following the pandemic. So we've put aside effectively £1 million in the Improve Better Care Fund, which is part of the settlement which goes into the overall adults to mitigate any additional growth that's balances.
I don't know that this has been fully understood. Paul's asking that through the council tax, we're being asked to take a 3% increase, which is the government cap, purely for adult social care, nothing else. So that money, I don't know how much money that generates. We'd need to know what that money, what that 3% attributes to. Then we can put that into this and see exactly what influence it has on it.
So can I suggest to do that? We haven't got that to hand. Could we go away and give you an answer to that question, Councillor Pritchard?
Yeah, that would be made available to all the panel members.
Yeah, of course it would, yeah.
Yeah, okay.
Thank you.
Can I just add, Councillor Pritchard, that in answer to your question about the Virgin contract, that question on the inflation doesn't include Virgin Care.
Right, okay. So can we continue then for the moment, please?
So that's the bit I've concluded in terms of the adult social care savings proposals. The next slide then goes on to the onto the public health ones.
Right.
Did you want me to just pause there, Councillor Pritchard, just to see if anybody else had any questions?
That's a good. Yes, it would be good. Are there any questions on the presentation as it is at present? Anybody from the panel? I'll look on the chat link. No. Oh, yes, I do. I have Alison. Alison, you wish to make a comment?
Yes, thank you. Yes, I had a question. I share the question about the 3% levy for social care and how that factors into this. I think that's a really important question. But also looking at the savings on the adult social care budgets, 603,000 on the reablement review, that sounds like a lot of money to me. And my understanding is that the reablement service is a very successful service that works very well. And what proportion of the reablement budget does that 603,000 represent? And how can we be assured that that amount of reduction in funding isn't going to impact on the outcomes that the service delivers? So that's one. And then the other one, the 537,000, which again is another big number, is that around making savings on out of area placements? Is that what that's focusing on? And is the idea that it would be possible to bring people back to local services and that will generate those savings, or is it something more than that?
Do you want me to come in here, Mandy?
Yes, please, Les.
So Councillor Bourne, they were very good questions, actually. You're absolutely right. We have been looking at, you know, our strategy is that people are out of area. We want to bring closer to home. And we've identified with Virgin Care some people who we think would be better supported if they were brought back home. And we've got plans in place working with housing colleagues to look at that. And those plans are already afoot. So that is an element of that. We're also working with some of our providers in terms of just looking at their overall costs. So there's kind of two prongs to that, if you like. In relation to the reablement, it's not taking the money out of the reablement budget because we've just reviewed all of that. What it's doing is demonstrating that by giving people the reablement support, they won't need ongoing longer term support. So it's that cost avoidance of money, if you like. So we've identified we should need £603,000 less to spend on adult social care because there will be less call on longer term services. Does that answer? But you're right, that is a big figure. But it isn't coming out of the reablement pot of money to deliver the service. If anything, what we've done is bolstered that service across the CCG and the council in order to do that cost avoidance piece, because there are better outcomes for the person in the end.
Okay, so you're hoping that the input from the reablement service will mean that people don't need long-term support, that it will deal with their issues in a way that it lessens the demand for longer-term packages of care.
Yes, so it's better. Yes, exactly. So it's better for the person because they get that quick reablement support, which is there for up to a 6-week period. They've got their therapies in there, and so hopefully they will be supported in that way to not need longer support or to come back at a later stage, but not initially. If that's needed.
So where is the money coming out from?
It comes out from the adult social care budget.
So the money
for packages it comes out from the packages and purchasing budget that we currently spend. So it's a reduction in that.
Okay.
Rather than a reduction in the money going to the providers supplying the service.
Okay. And how confident are you that those savings can be made? What evidence have you got to support that?
In relation to the big figure, which is the just under 2 million, we've done a lot of work. We've done a lot of work on. We've done a lot of work forecasting and looking at that, and I'm confident in that figure. In terms of the top line, the 537, you know, if I had to go through them, I'd say it does need more work on that. We've identified the people and we've identified the providers, but we are reliant a little bit on getting some housing support as well, some support from housing colleagues as well. And you know, a number of things have to come together for that to come to fruition. But we are, you know, we're all working together to try and achieve that, not least because it is the better outcome for the person. And in terms of the reablement one, I've rag-rated that as amber in terms of what we've submitted. There is more work to do on that to make sure we can demonstrate that cost avoidance in a financial way. So I have reg-rated that as amber, but we're hoping that through the modelling that we've done that we can deliver that. And with the one that's the 19,000, then that's already been achieved, so that's definitely green.
Yeah. Okay.
So on the reablement, the equipment, Les, is that being successfully recycled?
The equipment is a slightly different issue. We've got a paper coming towards one of our committees at one of our groups at the moment around the reablement, around the equipment service, to look at that in more detail. I haven't read the detail of that paper as yet, so I don't really want to comment at the moment on that, Vic, if that's all right.
No, it's just.
But we are working on the equipment service, because you're right to identify that.
Chair, can I just declare an interest on that?
Yes, thanks, Councillor May. In terms of Sirona, that's right.
Right, Paul, you wanted to come in.
My question relates to the bottom, the £2 million at the bottom. You've said a review of the care package delivery, and then you've said about identify efficiencies in existing packages. What I'm concerned about is, having seen services in other authorities, including North Somerset, that you can actually really harm people, and I've been proud of the services that we've provided. Is this going to actually result in a lower level of service to our most vulnerable in the community? And can you provide a bit more detail so that when we have the debate at the full council, that we can actually see whether that's an achievable figure or not?
I can provide that at a later stage, if that's all right, because I can break it down in some detail into the types of groups. For some people, it will mean no change at all in their service, and it might mean that some funding comes from a different source, for example. So we know, for example, we've got some people in receipt of what's called Section 117 funding, that the council currently funded the totality of that. And actually, when you work out the split, when you've gone through the review, then there will be an apportionment of a different split with CCG cut with the CCG commissioning funding as well. So we're confident in some of that coming through, and that won't have any impact on the person at all because of the legal requirements and duties around that. There are other people that we may be over prescribing for already, for want of a better word. Now, what I set out at the beginning with this is that we will always make sure our statutory requirements are met. It is incumbent upon us as the local authority to do that, and we will not be changing that position. Now, if some people are getting a greater level of support than they are eligible for with the Care Act, then it might mean that is the case, Councillor May, but it is not our intention to do that. It's to make sure that eligible needs are met. And we have a duty to make sure that we deliver that fairly across all of the people with care and support needs. So that is certainly the intention of reviewing the care packages.
Leslie, all I can say is I've seen in other authorities where they go down to the minimum level of service in the Act, and that service is not very good. So I'll be scrutinising this with some effort.
Yeah, thank you, Paul. And I welcome that, to be honest, because it's the people that we're serving. So thank you.
Okay, then, Kelvin.
Sorry. Thank you, Chair. Just a quick couple of things, please, Leslie. You've RAG rated the public health risk to delivery as all green.
Sorry, we'll need Mandy to come on to the public health bit. Should we put it up on the screen?
We'll move up on that one, Kevin.
Yeah, we can move on to the public health bit.
Oh, beg your pardon. Okay, sorry. Yes, I just to reiterate Paul's point though about on the service level and statutory needs are met, because that's similar to in the children's services when we talk about SEND and advocacy and those things that go to make the system work so well in Baines. Is the more you chip away at those things, the skeleton cannot move, with effectiveness and warmth. Thank you.
Thank you.
Okay, and Les, can we move on?
Yep, that's fine. It'll be Mandy will pick up the public health savings bit.
Okay, then, right. Down to you then, Mandy.
Okay, thank you very much. Could I just come back with a supplementary before we move on?
Go on then.
Sorry, I'll try and be quick. It was just thinking that if the reablement review is actually the 603k, there is actually a saving on care packages, then that's actually we're trying to save 2.5 million on care packages, if that's the case. So just wanted to check that my understanding on that is right. And then the other thing is on the 117 savings, section 117 savings, is the CCG aware of this and planning for it?
Absolutely, Councillor Bourne. We've been in regular discussions with the CCG about it, and indeed we're trying to get a common policy across BSW to make sure as 3 local authorities we're all in the same place. So that's an ongoing piece of work, and we wouldn't dream of doing that to colleagues in the CCG as well, because of the impact on both financial systems. And in terms of the 603, the reablement piece, it's money that we wouldn't be spending on social care, and I think you can see it both ways, actually, the way you've just interpreted it or the way that we've been trying to explain it. So it is a reduction in the adult social care budget at the end of the day.
Okay, thank you.
Okay.
Okay, Councillor Pritchard, shall I carry on to public health?
Yes, please.
Yep. So as I said, Bruce sends his apologies. There are 3 areas in public health, and I'll pick up the post at the bottom. Some of you may or may not know, but the public health grant that comes into the authority is ring fenced. So there are a couple of ways that those 153 savings are going to be delivered. One of those is because Bruce has done some work around, as you can see, the integrated sexual health service as well, around the payment plan for that. The other way you can use that grant is actually for where you can provide additionality in relation to public health outcomes. So in other words, where other services are providing, for example, discretionary services are providing additionality into the baseline model. So for example, you couldn't actually recharge some of your time for some of your statutory services in other parts of the council. So effectively, this is 2 ways. There's a little bit that this is going to be saved through some of the recommissioning that Bruce has done, but the second way is actually really distributing mainline revenue for some of the public health grant that comes in for some of the discretionary elements that are leading to some of our public health outcomes. When we RAG rate our actually savings proposals, obviously they're undertaken on 2 terms. One is on deliverability and one on impact. So whilst there is, like I said, there'll be an overall reduction in the council's revenue budget, actually, but we're just swapping one source of funding for another. The next line, the services to be stopped, actually this is fairly minimal. This is very small elements from the supplies and services budgets, the 17,000. The biggest piece in work of that is around, I think, £8,000 or £9,000, which is the schools survey, which I think is undertaken every couple of years. And I think it was mentioned earlier that actually that will continue because St John's have agreed to continue to fund that. So although we won't be funding it, the actual service itself and the survey, which does give us my understanding, some very helpful information from the schools to help inform some of our policies and sort of approach moving forward, that will continue. So the big area, which obviously Councillor May is interested in, is this saving proposal was put up some time ago in 2021 as part of the 2021 considerations as we've been developing the budget, was about moving leadership posts from the public health team itself. And as Councillor May quite rightly highlighted, that wouldn't be an appropriate thing to do at this time during the middle of a pandemic, when we have quite, I think Councillor Appleyard said, you know, we haven't got the biggest of public health teams. So the intention is that that post will not be taken out this year. So we will not be losing it this year, but we are going to use some of the COVID grant funding, which some of it can be rolled over into next year, which is the government grant funding, to ensure that post continues. And we will obviously review that through 2021 and look at where we are as we progress through, obviously, hopefully coming out of this pandemic, but those resources will be reviewed. But at the present time, it's not going to be taken out of the structure.
Right. Any questions on that from anybody? I'm looking in the chat facility. I don't see any there.
I think Kevin might put his hand up. I've seen him just on the side of my screen.
Oh, right. Kevin.
Yeah, sorry, beg your pardon. I was not quick enough on writing MIS in. Thank you, Mandy.
Yeah.
I suppose, yeah, so two things are just trying to go through my mind. So just to clarify, when you say that public health, or did I understand correctly, that public health is funded from government grant direct, which is ring fenced?
It actually comes in via another route, not through government. I think it comes in through Public Health England. Correct me if I'm wrong.
So that's ring fence for public health?
Yes.
So you have to spend that grant on public health?
Yeah, it is. And there was talk, Kevin, about that grant being de-ring fence, but at the moment it still remains a ring fence budget. So you have to deliver on public health activities, yes.
So any savings that you've listed here, the money's going elsewhere or covered elsewhere for public health. So that if you report back to Public Health England, you're still spending the amount of money they've given you.
Yeah, absolutely. And they will, and I've worked in previous authorities where they've scrutinised those returns. So you do have to show that it is delivering clearly on public health outcomes, and they do review those returns on an annual basis.
Yeah. So I was just, well, okay, thank you for clarifying that. So the question really is around the top two ones, which was around reallocation of council grant about, pressures and demands will build up, and what might those pressures likely to be, and the one about the infection control, and how, is this budget often used, or how would you get something there if you needed it quickly?
Sorry, could you repeat those questions again? Just repeat the first bit, if you would.
Yeah, so the top line is about, sorry, I've got a very small printout here, which is not helping my eyesight. Further pressures would accumulate in the system if that £150,000 saving were made. What are those pressures likely to be, was that one? And the second one was looking at the infection control budget. I know was kind of minimal in your 3 million or whatever, because it's only 3,000. But even so, is that budget often used, and what might be the implications there?
So the second one is a very easy one to answer, because actually we've got government grants in at the moment around infection prevention and control. So we have got grants in at the moment. So the small one, I don't see that being any of any significance, because actually there's funding, additional funding that we've got in to address those areas. And bearing in mind, infection control just doesn't sit within the public health teams; it sits within the environmental health teams as well. So I'm quite comfortable we've got capacity to deal with that side of it. The 153 around the pressures by actually effectively using some of the public health grant as other local authorities do. I have to say, we don't use as much of our public health grant as other local authorities do on the sort of the broader health services delivered by local outcomes. I'd have to get Bruce to talk about what the impact of that. So that would be one I'll have to get back to you on, Kevin, but I'm quite happy to share that with you and the panel as well. I haven't got that level of detail.
Thank you very much.
Okay, no more questions, I don't think. I'll just check. Alison.
I asked my question earlier.
You've had it. Oh, right. We've come up after Kevin, so I just thought you might have had another one. Okay. So we'll move on then, Mandy.
Thank you. I'm going to hand over to Mary and Chris now, who'll take you through the children's and education's growth and then savings proposals.
Okay.
Thank you, Mandy. So I'll take us through the growth, if I may, and then the next slide, Chris will join the contribution. So similarly, this slide in format is similar to the one that Les spoke to. So in terms of the pay inflation, again, that is in relation to those staff members who earn under 24,000. So very similar to the update that Les had given in terms of her area. In terms of demography for children and young people, we are requesting quite a significant growth in terms of the funding, and that reflects both the level and complexity of need that we are seeing coming through in terms of children and young people, and also the impact of contextual safeguarding that we spoke about earlier in the discussion. Because obviously as a local authority, we try absolutely everything we can as a local authority, and obviously with our multi-agency partners, to ensure we support children, young people and their family. But where we cannot ensure that happens adequately or safely, some of those young people do need to be accommodated. So the demography growth reflects that complexity of need that we're seeing among our young people, our children and young people, I should say. And then in terms of contractual inflation, an area we have proposed this year for our children and young people's commission services, that similar to adult services, that there is an uplift considered for our children and young people commission services. We heard earlier in panel about just what a vital role our commission services for children and young people do play. So our request and what we are purporting is that there is an uplift for those commission services in next year's budget. So overall, the growth that we are requesting is 2.5 million. I'll move on to the next slide, if I may. So then in terms of the savings proposals, what you will see in this slide is this is a combination of some targeted support in terms of where we're identifying some of the savings, but also in terms of some of the area that Chris will speak to in terms of that is coming from other grant funding in terms of those resources. What we have really tried to do in terms of broader children's services is minimise the amount of savings and the amount that will come out of our core budget. And there are no savings being proposed in this year around children's social care, but there, as colleagues will see there is some savings around identifying a different delivery model across our children's centres. In our integrated working team, there is a post that has been vacant for some time, and we have managed to reallocate that work, so it hasn't impacted on service delivery. And the additional slide talks about some of the savings proposals in children's for 22-23. And some of the work that we're currently doing is doing some work around Invest to Save. So we've got two key projects currently being developed. One is around enhancing our recruitment of in-house foster carers, as well as our model of foster carers, so that they actually we can have increased local provision and then less dependency on some of our more residential, therefore bringing down our costs. But we are also looking to extend our family group conferencing model, which historically only was available to children known to social care. But we've extended that model to increasingly work with our early help services, so families who not historically would be known to children's social care. So again, looking at that model of delivery and providing more support to families in the community, So where we can to avoid those children coming into care and or being with their extended families. So there are some figures identified for 22-23, but in terms of 21-22, those are the areas that we've put forward. We have looked to mitigate any of the impact in terms of children and families as best we can, and those are the numbers that we've put forward. Could I invite Chris to come in at this point then in terms of the SEND and the school improvement areas, if I may?
Thank you, Mary. So just picking up the 3 areas from myself, really, and always difficult when you're setting out on this work to decide how to do it. So I feel reasonably confident. I've looked at areas where we can mitigate the risk as much as I can, and the first one is around school improvement. So the funding there, the target saving of 87,000 was a post that was vacant at the time. We did, and we had over the last year, the 12 months, we've had a number of schools leave the local authority to join multi-academy trusts and academise, and the level of support that we need across schools isn't as high as it used to be. So the way that we're managing that, we have got a school improvement advisor still in post, and I've set aside some grant funding and some revenue funding which we've retained to enable that post to spot purchase additional support as it's needed. And also I made it very clear that should any of our schools get into trouble in relation to any Ofsted inspection, things like that, and need additional support, that there is a contingency plan in place to enable that resource to be provided. The other one is from my early years SEND team. They provide support to early years settings around early identification of SEND and provision of advice and support. Again, this is a post that's been vacant for a year. During that time, the team themselves, who are very capable, have adapted to a different delivery model. They're doing a lot more training and outreach, and had quite a lot of discussion with them about whether there'd be any change to provision. They feel really confident in what it is they're doing now in terms of their model and their outreach to early years settings, which I think is really, really good. So I feel confident that we can safely take what has been a vacant post. And the third area for myself is SEND advocacy. So this is advocacy which is provided from an external provider for children in our mainstream schools. Again, I'm not proposing to end that contract. I'm proposing that I have some grant funding from the DFE which came available, which I will use to fund this contract till the end of its lifetime. So not creating a service change. There will be a challenge in roughly 18 months' time when I need to look at the budget to support that going forward. But I'll take that challenge on then for the time being, and that enables us to provide that saving in year. So I'll end that bit there.
Okay. Can you just trawl up a bit, just see SEND advocacy and how much the saving target is on that?
I don't think I can, Councillor Pritchard. Actually, it's come to the bottom, but I can tell you it's 28,000.
28, that's right. Right,
so total savings for these areas as proposed are 265.
Smashing, thank you. So any questions on it? I think I got Kevin, haven't I? Yes, Kevin.
Yeah, I'm not sure whether Liz was before me, Chair.
Is it? I haven't got Liz on the list, so
I'm happy to charge in and then.
Yeah, you go, and then if Liz wants to, then she can put them on my list, please.
Okay, just the 2 quick things then, Chris. Sorry, and that is around the obviously the interventions to improve, invest to save again, which is fantastic, and the residential costs and lower things. We understand that. Can I just explain what the early years support, or can you let us know, maybe it's the next meeting, how that support is being delivered successfully at the moment, as opposed to, why the post is being deleted. So how it's going to be remodeled, if you like. And the only other question I had was the SEND advocacy. why was it established in the first place, and do you really want to reinstall it?
I can take those now if you want, Kevin, if that's fine. I'm assuming the early years, but you're referring to the SEND.
Yes, bless you. Yeah.
So, I mean, we've been talking in that service about trying to develop a more proactive and more enabling model, as opposed to, and what I mean by that is we had a team who would take inquiry of some nurses, and then they would drive out and see them and try to be a lot more hands-on. And what we found is that we needed to be a lot more enabling of settings and provided more training and a more office-like support so that we could have a broader outreach. So during the time when that post was vacant, the team moved to that model, and it's proved quite successful. So that's what I mean by the change. So it's doing more proactive enabling work, training staff, having a rolling training program, having a dedicated helpline, so that we're able to work more efficiently rather than driving around everywhere and trying to be everything to everyone, which with the best one in the world, when you've got that many early year settings, is always going to be really challenging. So we're quite happy with what we've done around that. And the SEND advocacy really is just about making sure that children have got a voice. And at the time, I mean, this was commissioned quite some time ago, before my time, and I certainly really value the provider. And I think what we'd probably need to do when we came to retendering is just to make sure that the business case is completely right, and we would need to do some consultation with schools to make sure that was the right support still.
Liz.
Thank you.
Thank you. Just looking at children's centres and the £43,000 that's going to be cut from their budget, it's saying that service efficiency is going to be made, and the services are going to be more targeted. But I'm just concerned that the services are more targeted in our children's centres, so it must be cut to the core, really. And I would just like to ask how you're going to make £43,000 cut and saving, rather. The other thing, I think I saw it in the print, small print, but I'm not sure I can find it now, that the other children's centres, places like Weston, etc., Twerton, are going to be closed, and there's just going to be one children's centre in Bath, which I would assume is Parkway.
Shall I respond?
If you would, please, Mary.
To both of those questions, yes.
To.
Thank you, Councillor Hardman. So in terms of the actual savings, I probably should have provided a bit more detail in terms of the Children's Centre itself. So there is a post that was the education post that has been a legacy of the old Sure Start model that only existed in St Martin's Garden, and that's the post that is the savings that's going to be achieved. But alongside that, similar to what Chris has indicated around early years support, our model will be that the early years support, which includes settings and all children's centres, will go into St Martin's as well. That therefore ensures that we've got an equity of offer for all of our early years and our children's centre settings across the patch. In terms of your second question or your second reflection, I'm not. That's not information that I've heard, and we've certainly got no. There is no plan around closing children's centres. But thank you for alerting me that you've read that somewhere. Thank you.
Thank you. Thank you.
Okay, Andy. Andy?
He was giving his apologies because he had another meeting at 2.
No, that was Paul.
No.
Oh, I do beg pardon. Yes, he's done it as well. Okay. Thanks, Alison. I suppose it comes to time now that, I mean, there's a lot of sort of ambitious aspiration in this, and we have to make a recommendation. Is anybody in a position that they feel confident enough to make a recommendation? Not. Do we need the screen? Can we return to the visuals? That's it. Yes. Thank you. So, as I say, we need to make a recommendation. We can either accept it as presented, with some hesitancy because we're not that enthusiastic about it. There's a number of concerns there that they've been given qualified answers, but as I say, it's highly aspirational. So shall we take it that we haven't got anything defamatory to say, but we just accept it as it's presented at the moment? Would that meet with the needs of the panel generally? Kevin, were you signalling? Yes.
Sorry, Vic, I thought just to say that based on what Paul had already said, that maybe that as you say, we can accept it on the basis of awaiting further information and clarification around the 3% impact and what that's going to do, and acknowledge the fact that all the officers have done their very best to identify wherever possible savings and mitigate any effects to the very best they've possibly done at this stage, given the information we have.
Yeah, so it's all at this stage. Mandy.
I was just going to say, yeah, thank you for that. There are a few questions. I've made quite a few notes, particularly as Mary, Chris and Les were talking as well. So we will make sure we get you the response to this. You know, it's really challenging, I think, for both members and members of the panel and officers. You know, none of us want to be in this position. And, you know, it's particularly challenging for us over the next 3 to 4 years, particularly because of our reliance over the last 10 years on obviously income that's been generated, which we have been sort of significantly and disproportionately impacted with what's going on. So certainly the feedback from the panel today, Councillor Pritchard, has been really helpful, you know, and we are trying to do our best to actually mitigate as much of these impacts as possible, as you can see, and we will try to do that. And, you know, certainly the feedback from an officer point of view has been incredibly helpful, and we will make sure we get you answers to those questions that you've raised that we weren't able to answer today. So thank you very much for that, everybody.
So budgets are never a comfortable operation, but you know, it's exacerbated this year in particular with COVID and the ongoing necessity to make savings. So we'll take it at that at the moment and bring that matter to a close. And thank you all for your very hard, diligent work. I'll take you on now to item 13, Director's Briefing, and I think that's you, isn't it, Les?
Yes, thank you. And I'm not quite sure.
Yes, we've got you back, have we?
We have. I'm not quite sure what happened with my video, but it's back on now.
Yeah.
So I think in the main, to be perfectly honest, we took a lot of questions, didn't we, earlier on when Councillor Appleyard was doing his when he was doing his briefing. We actually went through quite a lot of my briefing at the same time.
It's sucked up most of yours.
I think it has. The only thing I would highlight that's not already been discussed is that the PPE, which was originally available and free to providers until the end of March, has now been extended to the end of June, which I'm sure everybody will find incredibly helpful. Kevin, you wanted a breakdown in terms of the children 18 to 25-year-olds that had been on safeguarding adult plans, and you wanted us to break that down. So we've indeed done that and included that in here. I've just got an update while we've been we've been doing the call, actually, in relation to the escalation protocol, Kevin, that you referred to as well earlier on, and that will be finalised by the end of March and then be rolled out for the beginning of April. So that's in addition to this. We've talked about the ASD and the fair price of care, and then the only other bit was around the community safety and safeguarding partnership and the updates from that, which is, I have nothing to add other than what's already written in the report. So I don't think really, because I think we took quite a lot of questions earlier on when Councillor Appleyard was speaking.
No, that's fine. That's absolutely fine. Yeah, that's fine, Les. So unless there's any more questions that any of the panel members might have. I don't see anything on the chat facility and nobody's waving. So we'll take it as read then. Thanks very much, Les.
Thank you very much.
We're going to move on to item 14, the work plan. The only thing that's come up in the meeting
Chair,
is, yes?
Chair, Mary has her director's update as well. Sorry.
Oh, sorry, I beg your pardon, Mary.
That's all right. Thank you both. I'll try to be brief. Building on some of the earlier comments from Councillor Guy, I also wanted just to echo my thanks to all of our services, both within the council and to all of our schools, colleges and commission services. Staff have worked incredibly hard over the last 9 months to really look at how best we support our children and families. And while some of our commission services have had to change their model of delivery, where they haven't been able to see children as face-to-face as they may have wanted to, they have continued to work with all of our families and provide a comprehensive offer. So I just wanted to express my thanks and to include in that all of the work of our schools and colleges. In terms of children's social care, connecting families, our youth offending service and our children's centres, again, I just wanted to update colleagues, so colleagues are aware that we are continuing to deliver services as business as usual. We've had no relaxation in our children's social care statutory responsibilities in this phase 3. So children's social care continue to see children face to face. We continue to visit children as per their visiting frequency that's set out in either their child in need, their child protection or their looked after plan. And quite critically, we're working very closely with Chris and his virtual school, the head of the virtual school, in terms of coordinating that support to our most vulnerable children and young people across those categories. Colleagues may recall that in the first lockdown, the role of the virtual school extended to include support for children in need as well as child protection. And Chris and colleagues secured additional funding from the What Works Centre. So that's been able to be extended from September of 2020. So we've got quite a coordinated effort around ensuring that our most vulnerable pupils, all up to 18, are supported to be in school and learning. And the services are working very closely to support that. So I guess what I wanted to say to panel is that we are delivering services as normal in terms of our statutory responsibilities. Our most vulnerable young people at risk of offending are being seen face to face, as Sally mentioned earlier, in terms of our Broad Street office. And connecting families and our children's centres are continuing to deliver a comprehensive offer of support. We have communicated to the Safeguarding Board. We've made contact with all of our designated safeguarding leads in all of our schools. And we also set up an additional phone line for schools to speak to colleagues across children's social care in this period. We have sent out a comms message last week on Council Connect, and Chris spoke earlier about a newsletter that he'll be pulling together for schools and support to parents, and we will reiterate and would support that anybody who's got any concerns about children and young people to please report through in the normal manner, because the children's social care and all of our services are here. On a slightly different note, I just wanted to say that we've been waiting for some time for the independent review of children's social care to be announced, and it was announced on Friday of last week. So the chief executive of Josh McAllister, who was involved in setting up Frontline for social care, has been appointed by the government to undertake that review. And if I may, I will look to take a briefing to the future panel meeting on that review. The immediate priority that has been identified is that experts by experience are being encouraged to submit an expression of interest by the 5th of February 2021. And I know members will know that we've got a number of very effective young people who are well able to engage. So we currently are liaising with those young people in terms of supporting a representation from Bath and North East Somerset, because I think they would make a huge contribution. So if I may, we'll take a detailed briefing, but I could add the link to the guidance and the announcement on Friday to the minutes, Mark, if I may. And then on a really positive note, I'm really pleased to say that our young ambassador is now in post, and this is a care leaver. So again, in terms of our support from a corporate parenting and hearing about from our young people, it's really, really positive. And just on a bit of an advance notice, our next Children in Care celebration event will be the 3rd of June. Further information will come, but just to let colleagues know. And the final bit that wasn't on my submission, we heard earlier in terms of the HIP2, but just to let colleagues know that Children's Services met with Simon this week to look at how our young people can be involved in the consultation, and there is going to be some specific workshops with all of our key young people's groups that we've got across Bath and North East Somerset. That was it from me. Very short and sweet. Thank you.
Any questions for Mary? Oh, Kevin.
Sorry, Vic, just one very quick one, Mary. Has there been, through COVID, any backlogs on working with children in need or children protection plans or anything like that?
No, we have continued, Kevin. In the very first lockdown, in phase 1, the government did allow for relaxations of some of the guidance, but we have not moved away from our normal statutory timeframes in terms of children need child protection or looked after at all. The only thing we have done in this period, and Chris may add, is that in terms of protecting parents, we have moved to the child protection conferences being virtual, unless a parent particularly wants to have that face-to-face. So in this phase, that's the only real adjustment we have made. What we are doing, because colleagues will have heard about the pressure on services, there are equally pressures on our workforce. So we are reviewing our delivery model on a weekly basis. But as we speak today, we are delivering all of our services in line as we should be. Thank you.
Okay. So Mary, the provision of support services for children and young people, we rather expect it and take it for granted, but when you put it into words, it's very humbling, and there's certainly a real appreciation of what you all do. And I think that that's reiterated by all the panel members. So thank you very much. Thank you.
Thank you.
Yes, and I see the nods of approval, so that's good. Thank you. So now I'll move on to agenda item 14. It's panel work plan. And what's come up in that the meeting today is that we would at some time like a contribution of what the voluntary sector do and how they engage with us and support all of the authority services. So that's one. Is there anything else more? And you can put it forward, but I'm afraid that when Michelle and I actually look at it, whether it'll get into the next meeting or when it gets in is going to be a challenge in itself. We're scheduled to meet to finalise this meeting today at 1 o'clock. It's now we've gone over an hour and a quarter, so it's because you all make very valuable contributions. That's the way I look at it. It's not bad chairmanship. So, but so is there any contributions that people would like to make? I'm going to, right, Ruth.
Hello, yes, I just wanted to say, because there usually is so much to get through and discuss, could it be considered the idea perhaps of having more frequent meetings, but having shorter ones? I know that will mean more, possibly a little bit more work for the officers, in particular Mark, but I think maybe that would be worth considering. I don't know if monthly would be too often or every 6 weeks, but we always seem to have this difficulty, don't we, that there's so much to get through. Anyway, thank you.
The thing is, Ruth, is that everything we deal with is so sensitive, and it does instigate a lot of searching questions. And if you have more meetings, they would in their turn stray over at the allocated time, I'm afraid. And it's the democratic costs, whether the democratic services could meet with the costs of extra meetings, because they don't come, I'm afraid, free of charge. I don't know, Mark, if you want to make a comment.
I was going to make a comment, Councillor Pritchard, if that's all right. I mean, we did obviously do a review of the scrutiny arrangements, as you're aware, and they did change in response to some of it is in response to resources as well, but not wholly. I mean, I think the thing to do, there is going to be, the LGA are going to do some peer support, aren't they, in helping us review our scrutiny arrangements. So maybe that's the time to think about that, Councillor Malloy, as part of that process as we review through the LGA. But, you know, they were actually tailored as well, and there was resource taken out. I'm sure Mark is going to say the same. Some time ago, so I think it's something we have to consider carefully. But there is a particularly heavy workload with this panel. I can see that from my first meeting today, so I think we perhaps need to give that some more thought. But certainly, you know, our resources are tailored to the you know, the volume of work there is for our democratic services colleagues.
And this is a short meeting by comparison. The agenda wasn't that onerous today, and you can see the time it consumes, and of course children and adult social care eats up the biggest part of the council's budget. So I'm in a veiled way saying that we're the most important scrutiny panel, and just remember that, Mandy. Right.
Yeah, I've heard the message, Councillor Pritchard.
Right, you are. So I'm going to bring the meeting to a close now, because and if you'll allow Michelle and myself to get an appropriate panel meeting setting, gender setting meeting next time round. Okay, it's and thank you all absolutely for your contributions. It's been invaluable. Thank you all, officers and panel members alike. So bring the meeting to close now.